You found my name in the rain on the porch. I kept it small like a pin in a glove. Your shadow leaned on the apple crate step, and the clock in the hall would not answer us. Stay a little while, stay a little near. Your breath on my cheek like a borrowed fear. Dance me slow, paper moonlace. Hold my hand in a stranger place. Hold my hand, sweet and still we could disappear. Dance me slow and leave me here. Your collar was white, but your eyes were bold, like a key in a jar with a secret hold. I heard the boards count softly our feet, and the room grew thin as a candle leaf. Stay a little while, stay a little near. Your breath on my cheek like a borrowed fear. Dance me slow, paper moonlace. Hold my hand in a stranger place. Hold my hand, sweet and still we could disappear. Dance me slow and leave me here.
Good morning, everyone. How are you? I hope you guys had a great afternoon and evening yesterday. All right, so we're back this morning. Give me just 1 second. I need to find where this is at. Hold on. All right. So we're back this morning with testimony in, what are we on? Day 8? Yes, day 8, I think. Let's look. Yeah, day 8. All right, so we're back with day 8 of testimony, and they're going to start this morning with some rather difficult testimony, but it's going to be the medical examiner. Now, I will say this. The Commonwealth has decided that they're only going to question her about one autopsy, which is Callan's autopsy. And I'll tell you what I think. I suspect the reason they chose Callan is because they knew they were going to be showing autopsy photos. He had medical therapy in the hospital. And I think they did it, quite frankly, because his autopsy photos, all children's autopsy photos would be shocking. But because he had medical therapy in the hospital and in the ambulance, his are going to be a little more shocking. And I think they did it to elicit. I think what they want her to be found guilty, and I think that they want her to be found guilty of premeditated murder is what they want her to be found guilty of. And I do feel like if they had only wanted to prove the requirement that one of the children, all of the children are deceased, their cause of death was asphyxiation and mechanical asphyxiation, and that it was homicide, they could have used Cora or Dawson's autopsy. I mean, they do have to prove that in the counts that the person that they're charged with murdering is actually deceased. So if they had wanted to just if this was just simply a situation where they're just having to, this is part of dotting the I's and crossing the T's, then they could have used the other two children, one of their autopsies. And they didn't, which leads me to really believe, quite frankly, that they are wanting on some level, not only a guilty verdict, but they're wanting it to be based on emotion, on hatred for Lindsay Clancy. The problem with that, as I see it, is I think it's dirty pool, number one. I think that if you have a strong case, you don't need to appeal emotionally to the jury. I think that I think it's ridiculous. I think that it's ridiculous to have put the jurors through that because you need to get a guilty verdict, and it's not even just that they are seeking a guilty verdict. They really would like, ideally, for her to be found guilty of premeditated murder. She's conceded that she did this. Her defense is an affirmative defense. This, I just find it messed up that we are on day 8 and haven't really heard a whole lot of testimony about her state of mind. And I think back to the way that Letitia Stauch's trial was, the order, how her case was tried. And in the first, I think it was like the first 3 days was the testimony that's required, the dotting the I's, the crossing the T's testimony, right? But then we started getting very quickly the people that had evaluated Letitia while she was in El Paso County Jail, the ones that had interaction with her, her ultimate evaluation, and the like. I wish that they were doing that in this case. I think it would be a better case. I think it would be better for the jury. I think they're trying, it just feels like they're intending to get an emotional verdict, and I don't like that. I know they don't care. I'm not a constituent of Massachusetts. I don't vote there. I don't pay taxes there. So therefore, my opinion is irrelevant to them. But you guys are here, so I'm assuming that you're here because my opinion is relevant to y'all. All right, so here's what's going to happen. We're going to get the medical examiner with testimony first. Even though the judge is going to tell the jury, okay, we're going to take this break. Here's how the schedule is going to go. We're going to take a mid-morning break, blah, 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 right? You assume from that discussion that there's going to be more than one witness on the stand and then the morning break. No. I don't know if the jury was emotional or not because they don't show the jury and you can't really hear any of them the way that it's all set up in there. So I don't know. But after the medical examiner testimony is the break. So we'll just get right to it.
All right, good morning, doctor.
Good morning.
All right, come off. Could I see Counselor Sylvia for a second?
I don't know what this is about. I'm assuming that it has to do something with what the bailiff just told the judge, but there was something else so I was listening to this while I was in the shower and getting ready for the day. So I didn't, the judge did not give the admonition to the people in the gallery or the camera operator in the courtroom about not showing the autopsy photos, but I think that's like a given. We're not going to see autopsy photos. And if you wonder why I'm kind of stalling for time, because it's because I want to make sure we have enough time to skip. So there you go. Okay. For lunch, because they did take such an extended morning break. I'm glad everybody's back today. Thank you so much for being here. If you wouldn't mind giving your girl a thumbs up.
Does that work better for everybody? Okay, all right.
I don't know. Maybe it's scheduling. Who knows?
Good morning. Can you please state and spell your name for the record?
Yes, it's Kimberly Springer, Kimberley Springer.
Where do you work?
At the Office of the Chief Medical Examiner in Boston, Massachusetts.
And are you a medical examiner?
I am.
How long have you done that?
20 years.
Can you describe for us your educational background?
Yes, 4 years of college at Wellesley College in Wellesley, Massachusetts. 4 years of medical school at the Chicago Medical School in North Chicago, Illinois. 4 years of residency training in anatomic and clinical pathology, which is hospital-based pathology at the Brigham and Women's Hospital in Boston, Massachusetts. And 1 year of fellowship training in forensic pathology at the Office of the Chief Medical Examiner, which is where I now work.
And throughout that 20 years at the medical examiner's office, have you conducted autopsies?
I have.
Approximately how many?
Over 2,000.
And have you testified in courts in the Commonwealth about these autopsies?
I have.
Can you explain to the jurors what is an autopsy?
Yes. An autopsy is a tool by which we examine the whole body in an effort to determine cause of death. And it's comprised of two parts: an external examination, where we look for identifying characteristics such as height and weight, evidence of medical therapy, and evidence of trauma and disease. We may take evidence as appropriate, and then we turn to the internal examination, making surgical-like incisions and examining each of the internal organs, again looking for evidence of trauma and disease, and taking additional samples for other tests such as toxicology.
Now I want to direct your attention to January 29th, 2023. Did you perform an autopsy on Callan Patrick Clancy?
I did.
And when you performed this autopsy, did you follow the procedure you just described, where you did an external examination and then an internal examination?
Yes.
And can you tell us what your initial observations were of Callan when you started the external examination?
Yes. So Callan had some therapeutic procedures in place, or therapeutic equipment in place, including a thermometer in the left nostril, a nasogastric tube in the right, an endotracheal tube down the throat, a Foley catheter draining urine, intravascular catheters in the right hand and right wrist, and an intravascular catheter in the left foot. There was some adhesive residue, possibly from other therapeutic procedures as well, on his chest. And there are additional needle marks that I saw on his body. In general, should I keep going? Or?
Well, what were your general observations?
In general, he was, we measured him at 26 inches long and 24 pounds. He had general edema, and those are the general.
So when you were talking about therapeutic things, are those things that were done by a medical provider at a hospital or some such setting?
Correct.
Okay. And what do you mean when you say he had general edema?
It means that he had his whole body had more fluid than one would expect in a person, or an 8-month-old who had not been in the hospital. It's very common for someone coming from the hospital to have had been given fluids such that they have excess fluid and swelling.
Did you make observations of any injuries or trauma to Callan?
Yes.
If we could have photo 9960.
Hold on, let me just, members of the jury, I just want to give you, kind of revisit that instruction that I talked to you last week about. If you may remember, we talked about before they played that tape, all right? I just want to remind you that sometimes evidence is presented in the trial that creates emotional reactions. But as jurors who've taken an oath to follow the law, I'm instructing you, as I did last week, that you must separate any emotional reaction on your part from the informational value and the weight from the evidence. You must not be influenced in any way by the unpleasant nature of the photographs and testimony that you're going to hear this morning or throughout the whole trial as well. So you must find the facts in this case based only on the evidence. But you can't find those facts or base those facts on sympathy, anger, passion, prejudice, or pity against either side. So I appreciate that. I just kind of wanted to remind you of that. And with that, come on.
Thank you, Your Honor. So photo 9960. Is that on the screen, Doctor?
Not yet. Yes. Okay, thank you.
If you could just describe for us what we're seeing here in this photo.
So this is a photograph of Callan at the time of autopsy, and I'm showing a ruler underneath his neck, where above which you can see abrasions, and you can also see some needle marks that I mentioned from therapeutic procedures on his arm.
I'm sorry, if you could use the tool, pressing the top button there, just to highlight the area you're talking about, the abrasions on the neck.
Right here on his right side of his neck, and then in the middle of the neck and on the left side of the neck.
And if we could now have photograph 663. If you could tell us what we're seeing here in this photograph, Doctor.
This is another photograph showing a bit more closely, again, the abrasions of the neck. There's one on the front of the neck, the shorter one that's about ½ an inch long by 1/16 inch. For those more familiar with the metric system, a centimeter is 2.5 centimeters is about an inch. 1/16 of an inch is about 1.5 millimeters. So this is ½ an inch by 1/16 inch. And then on the right here, this is about 1.5 inches by 1/16 inch.
And then showing 9952.
May I go back to that for 1 second?
Go back.
For one.
Could we go back to that photo, please? 9960. I'm sorry, 663.
I just want to point out between the ruler and the abrasions, you can see a paler line. That's a normal infant neck fold. That's not a injury.
Thank you. And 9952, please. If you could just point out for us here the injuries of significance to you.
Here, sorry, I think I did that.
We could go back to the prior photo, please.
I got it.
It's the top button.
Yep. Okay, so these again are the abrasions on the left side of his neck, and there's the one on the front of his neck. In addition, on the left side of his forehead is a 3/16 inch by 1/16 inch abrasion, and I think you can also begin to see petechial hemorrhages, which are dot-like hemorrhages underneath the skin on the face.
And what are petechial hemorrhages?
Petechial hemorrhages occur when there is rupture of the small blood vessels underneath the skin surface, and they are from an overpressure of the small blood vessels such as capillaries or venules, and blood escapes out and makes a dot-like hemorrhage.
We could have photo 9954. If you could explain for us what we're seeing in this photograph, please.
In this photograph is Callan's right side, also showing the back of his neck. So that abrasion that could be seen in the first photo showing the front of his neck, that abrasion continues along about 3 inches in all toward the right posterior or back of the neck.
And if we could have photo 9955, please. Is this a close-up photograph of what you just described?
Yes, I can show that right here.
Okay, so obviously we can see that Lindsay is very emotional. Now, when I was listening to this testimony, I was for the like last half of it, I was in the shower. From the beginning of it, I was like, you know, getting the water ready and all that stuff. So I was watching the chat, and it was brutal. They wanted to know how come the jury was admonished for not showing any visible emotional reactions, and Lindsay's over there beside herself. Why wasn't she? How come she hasn't been admonished? I'll say this. I'll tell you why she hasn't been. It was brutal, you guys. There were way worse than that, but I'm just going to tell you the tame. So I'll tell you why the judge didn't admonish her, because her crying is quiet. It's not like, remember when Donna Adelson was found guilty and she, you know, she had that, oh my God reaction. And then the wailing was so loud that it was distracting. If she starts crying to the point where it becomes distracting, yeah, he's going to say something to her. But at this point, he doesn't feel that it's become distracting, and that's why he's not saying anything. And also, the jury has to be admonished. They have to be reminded that they're supposed to base their verdict on the evidence presented, not emotion. However, in this situation, I firmly believe that the prosecution, the Commonwealth, used Callan's autopsy as an emotional ploy to the jury. The fact of the matter is that even if a jury saw these medical therapies in place on an adult, it's very scary looking to the average person, right? So can you imagine looking at medical intervention of this type on an 8-month-old baby? It's invasive. He had a trach tube. He had a catheter placed. It's a lot of tubes and things to be looking at on such a tiny little human. And that is to elicit, in my opinion, emotion. And I don't know how to, I don't appreciate that. I don't think that's proper. I don't think that that's the way you go about getting a verdict as the state. ADHD Playlist says, at first, I didn't know how to feel about Lindsay, but this trial really showed me what she was going through. I don't even have kids, and I feel pressure as a wife. I can't imagine how she felt. I think that's incredibly open-minded of you. There's been a lot of really quick, harsh judgment, and I'm open to everybody's opinions. I've kept my mind open throughout this trial. Where I'm at as far as coverage is, I'm on the fence. I'm still straddling the fence. I haven't even leaned one side or the other because at this point, in my estimation, there hasn't been any evidence presented by the Commonwealth that has moved me from straddling the fence. I really can't, I can't state it enough that I think that using emotional tactics to elicit a guilty verdict on the behalf, by the part of the Commonwealth is dirty pool, and I don't like it. All right, let's go.
Thank you. Could we have photo 636, please? And if you could describe for us what you see here in this photo, Doctor.
First, the abrasion is in poor focus, but it's in the picture on the left side of the photograph. And then the most in the photograph, one can see those petechial hemorrhages better along the cheek, on the eyelid, all of those.
We could have photo 654, please. Can you describe what we're seeing in this photograph, Doctor?
Yes, this is an abrasion near the hairline on the right side of the forehead. And that is up here. That is about 3/8 by 1/8 inch.
And then photo 656, please. Can you describe what we're seeing in this photo here, Doctor?
This is looking at the top of Callan's head, and on the top right part of his head toward the front, near the forehead, is a 1/8 by 1/16 inch abrasion.
And then photo 657, please. You can describe what we're seeing here, Doctor?
This is the abrasion on the left side of his forehead with a ruler this time. In addition, the petechiae are also in pretty good focus on this.
And then photograph 9916. If you can describe for us what we're seeing in this photograph, please.
So these are some of the, I forgot to mention at the very beginning, there's a intravascular catheter in the right groin. This is Callan before we took off his medical therapy, and it shows some of the needle marks that he had. So on this is his right lower extremity. This is a look of an intraosseous catheter attempt with a central puncture mark and a round abrasion around it. And then here's the right groin line and the left foot line.
And if we could have photograph 9917. Are we seeing the same thing here on the left leg, those same IO attempt marks?
Exactly, yes.
Thank you. Doctor, are you able to date the wounds to the head, the abrasions and marks on the head? Are you able to say when those got there or how long they'd been there?
I can't precisely, but they have signs of healing in the form of scabbing.
And would that indicate that they weren't fresh wounds that happened the day you saw him or the day prior?
Correct.
In terms of the marks around Callan's neck and the petechiae around his eyes and face, did that give you an indication here of the mechanism of death for Callan?
Yes.
And how so?
It is consistent with a ligature strangulation, given that the abrasions are linear around his neck and there are petechial hemorrhages above those lines of abrasion.
And how is it that when someone is strangled with a ligature, that causes petechiae in the face and eyes?
So what happens is that the blood vessels that supply blood to the neck are compressed. And so there are jugular veins which are a lower pressure system, and carotid arteries, which are a somewhat higher pressure system. And so as the vessels are compressed, if there is a backup of blood in the head, there can be an increased pressure in those small blood vessels that I mentioned, and they can rupture, causing the petechiae.
So basically, is it similar to a balloon filling up, but it's not air, it's blood and pressure in the face?
Yes.
And so when that pressure gets too great, is it that the capillaries are basically bursting and causing those little red marks?
Yes. Most texts say capillaries, some say venules, the small blood vessels.
And how is it that this process, the strangulation by ligature, causes death physically? How does it physically happen?
So the blockage of blood, either both to and from the head or just from the head, will cause a lack of oxygen to arrive at the brain. And there can be an element of airway compression as well, such that the lungs can't oxygenate properly. So that lack of oxygen is what causes the brain to die and the organs to fail.
And based on your examination of Callan, did you come to a determination based on your training and experience to a reasonable degree of medical certainty as to the cause of his death?
Yes.
And what was that?
Complications of mechanical asphyxia.
And why is it complications of mechanical asphyxia instead of just the asphyxia itself?
Because he was resuscitated, and so his heart began to beat again. So from the 24th to the 27th, there was a continuation of support of his organs to in the hospital. And so if he had a stopped heart at the scene, and in that case I would have just said mechanical asphyxia, but since there was a 3-day hospital stay, I said complications of mechanical asphyxia.
So the word complications doesn't mean that something happened at the hospital to cause his death. It's just that the strangulation caused his death, but he didn't die for a few days.
Correct.
Commonwealth would move to submit the autopsy photos as the next exhibit.
Same objection. Same objection. They may be admitted.
Commonwealth would move to submit the death certificate of Callan Patrick Clancy as the next exhibit.
No objection. That may be admitted.
I have nothing further.
Counsel? Thank you. All right. Thank you. You may step down, Doctor.
Thank you.
All right, Counsel, can I see just briefly?
Yeah, he's going to see him briefly, blah, blah, blah. There's going to be a break forever. And then we're going to hear from the pediatrician, the Clancy Children's pediatrician.
All right, jurors entering.
Right after the jury enters. It's an absolutely heartbreaking case, and I don't know. I guess I'm just frustrated with all of it, and I feel like I need to quantify or qualify, I should say, what I'm saying, and it's my admonishment
This
of.
now in session. Please be seated.
Excuse me. Your Honor, for the purpose. Excuse me, Madam Court Reporter or Madam Court Clerk. Here's the deal. I always feel like I have to qualify what I say about the way that the prosecution is trying this case by saying that in no way am I trying to diminish or devalue what happened here, and that there is a loss of life of 3 children. And with that, everything that would have happened in their lives, right? All their firsts, all the good things, all the, everything, right? But also the world was robbed of their potential. I'm not trying to, I'm not diminishing that. I'm not devaluing that in any way, shape, or form. I can, both things can be true. I can acknowledge that and still not like the way that the state is trying this case. There's my disclaimer. Let's keep going.
For the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right, thank you, everyone. So we're going to now return to the Commonwealth's case. Attorney Sprague?
Thank you, Your Honor. Commonwealth calls Dr. Lindsay Rochert.
Good morning. Can you stop right there, raise your right hand to the clerk?
Good morning. Do you solemnly swear that the testimony in the evidence you shall give Yes, you may have a seat.
Just watch your step, please.
Good morning, Doctor.
Good morning.
Attorney Sprague?
Thank you. Good morning. Can you please state and spell your name for the record?
Lindsay Rochert, Lindsay Rosshirt.
And what do you do for a living?
I'm a pediatrician.
Where do you work?
I work at Quincy Pediatrics.
Back in 2023, where did you work?
South Shore Medical Center.
And how long did you work there at that point?
In 2023, I think I had been there for about 7 years.
And could you just briefly describe for us your educational and training background that enables you to be a pediatrician?
Yes, I completed medical school at UConn and then did my pediatrics residency at Mass General.
And when you were working at the South Shore practice in 2023, were you assigned as a pediatrician for the Clancy family?
Yes.
And how long had you been their pediatrician?
I'm sorry, how long had I, can you repeat that question?
How long had you been the family pediatrician for the Clancys?
I believe I started seeing them around 2019.
And in the practice that you were in at that time, was it just yourself or were there other doctors and nurse practitioners and staff that would treat and see patients?
It was a somewhat large group.
And so would you always be the one treating the Clancy children, or would some of your associates sometimes see the children?
I did all the checkups, but if there was a sickness and I wasn't there that day, they would be seen by another provider.
And by checkup, are you referring to a physical or a well visit?
Yes.
And then if, for example, one of the children were ill and the family called to make an appointment, they would see who's available?
Yes, they would always check my schedule first, but often have to see someone else.
And would you have access to their records as their lead pediatrician to review if they came in for a sick visit or something like that to keep yourself updated?
Yeah, often at the time of the checkup is when we will go back and see what visits they've had since the last time we saw them.
This time would move to submit the pediatric records from South Shore Medical Center for Cora, Dawson, and Clancy.
Any objection?
Sprague, wait a minute.
They may be admitted.
If we could focus for a moment on Callan Clancy. He was born in May of 2022, correct?
That sounds right, yes.
And you were his pediatrician from the time he was born?
Yes.
While you were his pediatrician, did his mother, Lindsay Clancy, ever talk to you about Callan having issues taking a bottle?
Not that I can remember.
Thank you, Bloom. Thank you for the gift. I appreciate that. Thank you so much. That was really generous. Thank you.
Was there anything out of the ordinary health-wise with Callan?
No.
Was there any issues, or were there any issues with him meeting his milestones?
No.
What about Dawson Clancy? Did he have any health issues or concerns that you were aware of?
If I recall correctly from the notes, I think just a peanut allergy, if I remember, but otherwise he was healthy.
And Cora Clancy, did she have any medical issues?
I think asthma, that was pretty well controlled, but she was also healthy.
Now, In your role as a pediatrician, are you aware of postpartum issues, and are there certain things that you look for in new moms when you're treating babies?
Yes, we're certainly aware of it, and we try to look for any kind of outward signs at some of the initial newborn visits. Do you want me to elaborate?
Yes,
on
please.
that? So, for example, things we might look for would be if a mom is kind of has a flat affect, or not really making eye contact, or tearful, or having trouble bonding with the baby.
And if there are those issues that you see, do you document them in the medical records?
Yes.
And what do you do in terms of treatment or care when you see those things?
Yes. So since we're obviously caring for the child, we are not really able to diagnose or manage anything for the mom, but we do try to connect her with resources, whether Massachusetts has some postpartum resources, or often we'll refer to have her try to contact her OB.
When you were interacting with Lindsay Clancy, when you were treating her 3 children, did you ever see the need to refer her for any of those services?
No.
And did you ever see any of those visible signs that you talked about, the flat affect or anything like that, when you were interacting with her?
I don't remember anything like that, no.
Now, I want to ask you about some of the things that are in the medical record that the jurors will see, so that you can just kind of explain what they'll be looking at. Showing you a record here from January 18th, 2023. Issues with the brightness, I'll just bring it to you. You just look that over, and is that consistent with the medical records from your practice?
Yes.
And so, for example, with this visit, Callan Clancy, 7-month-old male, here with mom for bilateral ear pulling and fussiness. So is that typical in the medical records, where you'll document the patient being seen, the age, who they're there with, and what the issue is?
Yes.
Okay. And how do you get a history? Say when a kid comes in and they're sick, how do you get the history of their symptoms and what's going on with them?
So we usually do a brief review in the chart just to know what their anything on their so-called problem list for medical conditions, and then in the room we ask the parent the story. In pediatrics, usually we have to rely on a guardian,
especially when it's like a 7-month-old who can't speak for themselves. So it would be whichever parent or person is there giving you their concerns and the symptoms, and communicating with about what's going on.
Yes.
LB Hayes, you make an excellent point. LB says, hi all, hi. I think the main thing to keep in mind is the question, could she have done all this that is in the evidence regarding the trauma the children sustained and still have been absolutely without an appreciation for how evil and wrong it was when she was doing it? And then they'll have to try and address that with the mental health experts. Well, to your point, that's an excellent point, but to your point, she could have asked the medical examiner, generally speaking, how long does it take to asphyxiate someone? That might have been helpful to know. If you take that number and you multiply it, times 3, because there were 3 children, that might have given the jury some measure of time. But she didn't. I don't know if that's allowed, though, so maybe that's why.
And if there were any issues with communicating with the parent present, would that be documented in the medical records?
Yes.
And you saw Cora Clancy on January 24th, 2023 for a physical, correct?
Yes.
And as you stated earlier, prior to seeing her for the physical, did you look over her chart to see if she had been in recently with any illnesses or anything like that?
Yes, I would have done that.
And so would you have seen this note when her mother brought her in on December 27th, 2022, with some vomiting and sore throat?
Also, while this testimony was going on, there was a bit of a dust up in the chat about how the doctor ignored these injuries to Callan. Okay, so I think this is a discussion that bears having. The injuries that the medical examiner described were old, and pediatricians, caregivers in general, are taught. Little ones, they fall, they get bruises, all the things, right? But it's about where the bruising or scratches or lacerations are on their body that will be cause for an alarm. Okay. When my little ones were toddling around, especially my boys would take risks. So when they learned how to walk, they were not satisfied with just walking. They needed to climb. I have a picture of my oldest son at my mom's house with the cabinet door under the sink open, and he is standing on the cabinet door and reaching into the sink. So, I mean, kids fall. It's about, hi, Wolfie. It's about where they fall, how they fall, where the bruising is. There are certain areas on a child that you would not expect to find bruises or scratches on. The scratch on his head was relatively small. Crawling around, he could have done that any number of ways. So I don't know. Sometimes I think people overanalyze things and read too much into things. Also, I am almost 50 years old, and like when it happens, I'll be like, oh, that's going to leave a mark.
If there had been concerns at that point,
I'll be like, that's going to leave a mark, right? And then when the mark actually happens, I'll completely forget how I did it.
Appointment, they would have been noted in the record?
Yes.
And then as the pediatrician, if you'd seen some concerns, would you have addressed them with the parent?
Yes.
And that didn't happen on January 24th, correct?
Correct.
And speaking specifically to January 24th, 2023, that was Cora's 5-year physical, is that right?
Yes.
And sometimes in the record it's called a well visit?
Yes.
And what were your observations of Cora that day?
As far as I can recall, it was a very normal visit. Cora seemed to be behaving normally. No kid's happy to be there for a checkup, but I didn't notice anything out of the norm. She seemed perfectly well behaved, and Mom seemed appropriate as well.
Mom seemed appropriate?
Yes.
Did you notice anything out of the ordinary about Lindsay Clancy's demeanor or behavior or interaction with you?
No.
Was she able to give you a history of how Cora was doing and what milestones she was meeting?
Yes.
Was she able to answer your questions?
Yes.
Did you have any trouble understanding her at any point?
No.
Did she seem to have any trouble understanding you?
No.
Did she have, visible tears or a flat affect or anything like that?
No.
Did you have a discussion with Lindsay Clancy about Cora having some stomach aches?
Yes.
And what was your evaluation of that and your recommendation?
So we talked about the belly pain she was having. From what I could tell, I thought constipation might be possible. It's something we see a lot in kids. So I had suggested we try Miralax, which is a common stool softener we use, and wanted her to see me within 2 weeks if Cora wasn't feeling better.
Okay. And when you recommended the Miralax, was Lindsay Clancy receptive to that?
Yes, I believe so.
I have no further questions. Thank you.
Attorney Reddington.
Morning.
Good morning.
What's the time frame that you dealt with the Clancy children?
LB says, I was thinking the same thing. What was the time frame? Maybe it will be another expert. So when the medical examiner testified to that, she clarified that these already had the appearance of healing. They were not caused. They did not occur during the between the 24th and the 29th when she performed her autopsy. So I think that there's, oh, maybe you're talking about, or else are you talking about the, strangulation? Becky said, did the doc do a screener on Lindsay? They're supposed to. I believe that she asked some general questions, was the testimony. Maybe the doctor will get into, or maybe the defense will get more into it. Let's listen, and then we'll talk about that.
Because you took care of all three of them, right?
All three.
Right.
Yeah. Cora, I believe, was around 9 months old. So I want to say that I saw them from about 2019 until 2013.
And when you would see the children, who would bring the children to see you for the checkups? Was it Lindsay, or was it Lindsay and Patrick, or was it?
I think that Lindsay and Patrick came together for one of Cora's checkups, but as far as I can remember, every other visit was always Lindsay.
And being an experienced pediatrician and being very protective of your patients, little kids, you're always looking to see if there's anything out of the ordinary, bruising, anything indicative of any type of psychiatric problems they may have, stunted growth or anything. Is that correct?
Yes.
You're always on the lookout for anything else, even if it's not mentioned to you, right?
Right. Mm-hmm.
Did you ever notice anything like that on the Clancy kids?
No.
Did they seem healthy?
Yes.
Did they seem happy?
Yes.
And in all the times that you would see Lindsay with the kids at your office, did she appear to be a doting or concerned mother for the children?
Yes, she did.
One of the questions that the DA had asked you is whether or not you're familiar with postpartum depression, postpartum psychosis, things of that nature. Would you agree with me, in your experience, extensive as it is, that a person can be suffering from postpartum depression and or postpartum psychosis and still talk?
I'm not sure I have enough expertise to explain to answer that well.
That's fine. That's fine. Thank you.
Yeah.
Was Lindsay the type of person, to your observation and your treatment of her, that she was kind of like, was she like a complainer? Would she complain to you about the kids being a pain in the neck, and that she was aggravated with the children or anything like that?
Not that I remember, no.
In all of the times that you had seen her, let's focus, say, on the year of 2022 up through 2023, January 24th, when you saw the children, I'm sorry, Cora, I believe it was, last. Counsel had asked you whether or not you made any observations that you would have noted if she appeared to be suffering from any symptomology of postpartum. Do you recall her asking you that?
Yes.
And in your treatment of the children and in your observations of Lindsay, did you know, or did she indicate to you, or did Patrick indicate to you, or anybody indicate to you, that in October of 2022, she was seeing a psychiatrist?
No.
Do you know Dr. Tufts?
No.
Did you know that after seeing Dr. Tufts that she was placed on a selective serotonin reuptake inhibitor, SSRI, Zoloft?
No, I didn't know that.
And again, you're the pediatrician. It's not your job to pry. I mean, if you see something, you would make note of it and try to help them out. But I mean, if they don't tell you, you don't know, right? Did you know fair to say that you didn't know that she was then seeing a Dr. Paul, and then Paul left the practice and nurse practitioner Gelada?
I didn't know that.
Okay. Do you know them?
No.
The only reason why I ask if you know them is that South Shore Medical Center, is that affiliated with South Shore Hospital?
I believe it was already owned by the hospital at that time.
Okay. Latasha Dukes, nothing about her.
No.
Any medications? Did you know about her being on any medications?
No, I didn't.
She didn't complain to you and say that she had insomnia and that she was unable to sleep or having difficulty like that?
Not that I can remember.
Mental institution.
I didn't know that.
So when you saw her on January 24th, you did not know that she had been to McLean Hospital and had been on medications or anything, right?
That's correct.
Because again, she wasn't a complainer.
Correct.
She was a hell of a mother, wasn't she?
I always thought she was a good mom.
Thank you.
Redirect?
No, Your Honor.
All right, thank you, Doctor.
Thank you.
Commonwealth calls Susan Freon.
Okay, now this witness is going to be the daycare. It's not more the day school, I should say. That's probably a better word for where the kids went. They went to a little day school, and that's who's testifying next. But you know, the Commonwealth keeps reiterating that the people who saw her on January 24th, she wasn't, screaming, yelling, and completely incoherent and wild-eyed and all that, right? They keep trying to hammer that home. But here's the thing. When they have their psychiatrists testify, they're experts that evaluated Lindsay, they're going to have to concede, just like the previous psychiatrists had to concede, that there is internal psychosis and there's external psychosis. External psychosis, I think, is the thing that people think of most frequently when they think of psychosis. But people can have internal psychosis, and they can present very normal. And I use that term, normal is really relative, but they can present no outward symptoms. That's what I should say. They can present, you can't tell that they're struggling internally because it is an internal psychosis. And so I don't really understand the point of bringing these witnesses up on the Commonwealth's part, because quite frankly, they're testifying that she loved her children. She was a good child. She was good with the children. She loved her children. She was a good mom. So I don't think these witnesses are really helpful or beneficial in any way, shape, or form to the Commonwealth. At least not in my opinion, anyway. They haven't moved me.
Morning.
Morning.
All right. I'm going to ask you to keep your voice up and speak into that microphone.
And I think,
Please break.
to ATS's point, who says pediatrician office we go to always does a mom survey for postpartum moms, because a lot of times after birth you're there more than the OB. Absolutely. And I do think that the pediatrician was keeping an eye out. But if she is somebody who internalizes things, there might not have been any outward presentation. And, I'm sure she checked in with her, but the pediatrician can only do so much. And let's say, for example, ATS, you went to your pediatrician's office and were given a mom survey, right? And you answered no to all of the questions. And what could the pediatrician do more than that?
Please.
Thank you. Can you please state and spell your name for the record?
Susan Fraone, SUSAN, FRAONE,
And your date of birth?
11/26/82.
Where do you work?
Learning Sprouts,
And how long have you been working at Learning Sprouts?
almost 6 years.
What is Learning Sprouts?
Preschool daycare.
What age range of kids attend Learning Sprouts?
15 months to about 5 years.
And what age range do you teach?
The about 3-year-olds to 4-year-olds.
And back in January of 2023, what age range were you focused on
The
teaching?
3-year-old, 4-year-olds.
Was Dawson Clancy in your classroom?
Yes.
When did he start in your classroom?
September of 22.
And did you know Cora Clancy as well?
Yes.
How did you know Cora?
Most of the teachers help out in all the classrooms, so we get to know all the children.
And did you teach Dawson from September of 2022 until you went on maternity leave later on in 2022?
Yes.
Do you remember what month that was in that you went on leave?
November.
Prior to going on leave, so from September to November of 2022, were there any issues with Dawson?
He started having harder drop-offs around mid-October, I would say.
Is that typical for that age, or is that something unusual?
Sometimes, yes. It was a little not typical for Dawson.
So prior to that, he was fine at drop-offs, and then sometime in October, drop-offs became a little harder for him.
Yes.
And did that resolve over time?
Sometimes he would have better drop-offs, other times. But then I went on leave, so.
And after you went on leave, sometime after Thanksgiving of 2022, did you see Lindsay Clancy, Dawson's mother?
Don't really remember. I think I did.
Do you recall having a conversation with Lindsay where she asked you how your baby was and how you were doing?
Yes, we did have a conversation at some point because I was still bringing my oldest daughter to school every day.
Okay. And so you had your child in November, and then this conversation is sometime either around or after Thanksgiving?
Yes.
And when you had this conversation and interaction with Lindsay Clancy, was that at the school?
Yes.
And how was her demeanor?
Fine.
Was it any different than any other time you had seen her?
No.
Did she appear to understand you?
Yes.
Did you have any trouble understanding her?
No.
Did you have any concerns about her at that time?
No.
Was that the last time you saw her?
Yes.
And you're a mandated reporter, correct?
Yes.
So if you had seen anything about Dawson's behavior or about the parents' behavior at any point that caused you concern, you would have had to report that, correct?
Yes.
And at no time did you make any reports about the family or the children or the parents?
No.
When you had that conversation with Lindsay Clancy sometime in November of 2022, did she ever say anything about insomnia or not feeling well or being depressed or anything like that?
No.
Thank you.
Cross?
Morning.
So how long did you, in your capacity as a teacher at Learning Sprouts, know the Clancys?
I started at Learning Sprouts in November of 2020, and Cora was in preschool at the time.
Okay. So you obviously saw the kids on a fairly regular basis.
Yes.
And forgive me, what is a drop-off? What does that mean? I'm sorry.
When the parents drop the children off at school.
Okay. And when district attorney asks you with their difficult drop-offs, what does that mean?
Sometimes when parents drop the children off, they'll be a little clingy or they cry. Excuse me.
Okay.
Or they cry.
And that would be the child would cry, maybe the
Yes.
parent either, I don't know, but
Times.
so did they have difficult drop-offs on occasion, I guess, that Dawson
Yes.
would cry?
Yes.
How would Lindsay react? Was she okay? Did she seem concerned as a parent?
I wasn't seeing as much of Lindsay. I was seeing more of Patrick.
Okay. And Dawson appeared to be healthy and happy and engaged,
Yes.
as well as Cora?
Yes.
Thank you.
Nothing further.
All right, thank you, ma'am. You sit down, thank you.
Commonwealth would call Susan Bertolo as its next witness, please.
ADHD playlist says guilt could play a huge factor in her not expressing her struggles or showing it outwardly. Absolutely. Absolutely. Audrey for Kids says, I tried to hide my postpartum depression until it got so severe that I had to seek treatment. I think it's common for moms to hide or just cope with illness because that's just what we do. Absolutely. Absolutely.
Watch your stuff, please.
Good morning.
Good morning.
All right, I'm going to ask you to speak into that microphone.
Okay.
All right? And keep your voice up so everybody can hear you.
Okay.
All right. Come on.
Thank you. Good morning. Could you please tell the jurors your first and last name?
Susan Bertolo.
And if you could just speak as loud as you can into that microphone, okay?
Yep.
Can you spell your last name for the record?
Bertolo.
And what city or town do you live in?
Plymouth, Massachusetts.
And where do you work?
Leaping Frogs Preschool.
Prior to working at Leaping Frogs, did you work at another preschool?
Yes.
Where was that?
Learning Sprouts in Duxbury.
And how long had you been with Learning Sprouts?
4 years.
Did you teach a particular age group at that preschool?
Yes, I taught the older preschool group.
Okay, and at Learning Sprouts, are the classes kind of divided up in some way?
They're divided by age, like toddlers, younger preschool, older preschool.
And is there a particular label to the rooms that they're in? Are they referred to in a particular way?
Yes, we were sunflowers.
So your group, the 3 to 5 year olds, is the Sunflower group.
Yes.
And can you tell us a little bit about how the day is broken up for kids in the Sunflower group?
Sure. So some children came in early at 8, and then the rest of the kids came in at 9:15. And then some were half day and some were full day.
And as far as, excuse me, your role with the kids in the Sunflower room, you primarily interacted with them in the mornings, correct?
Correct.
And when the kids get dropped off, is it fair to say the bulk of the kids get dropped off around 9?
Yes.
And does that happen kind of like in a wave where parents drop off and they're kind of taken into the room as a group?
Yes, so the way our classroom was set up, we met them. They were dropped off to us at the door, and then we brought them into our classroom.
And they stayed with you in that classroom throughout the morning, correct?
Yes.
And the kids who stayed for the afternoon, did they stay with you in the Sunflower room or did they go someplace else?
No, they did not stay with us. We closed up our room, and our kids, the majority of our kids, we had a couple, went over to the Sweet Pea room, which was across the hall.
And so are you familiar with Cora Clancy, or were you familiar with Cora?
Yes.
And was she in the Sunflower room with you?
Yes, she was.
Drawing your attention to September of 2022, what was her schedule, if you can recall?
I believe she was scheduled, I don't remember the days. I think she came 3 days.
Okay, and for the 3 days that she came, do you remember if she was just in the morning group, or were there any days that she eventually did an afternoon?
So in the beginning of the year, she was 3 days and then went full day. And then towards the end of her time in our room, she did one afternoon, I believe. No, I'm sorry, one half day.
Okay, so fair to say there were always the two of you assigned to one room with the number of kids in the class.
Correct.
Now, as far as drop-offs for Cora, did you have the opportunity to interact with parents at drop-off?
Briefly.
And for Cora, who used to drop her off?
Both parents dropped off Pat and Lindsay.
Did you see one parent more than the other?
I recall seeing Pat more, but we took turns, so it was, we didn't really ask each other who dropped off.
When you say we took turns, you mean yourself and Karen?
Karen, correct.
Now, with the limited interaction at drop-off, did you have opportunities to interact in other ways with parents?
Yes.
And how did you interact with parents in other ways?
Email or typically our class dojo, which is an app for the class.
And that's something that can be done on the phone or a computer?
Correct.
And were the Clancys, meaning Patrick and Lindsay, fairly active or responsive to the dojo app?
Yes.
And do you know or do you recall who would be more responsive?
Lindsay.
How was Cora as a preschool student?
Amazing. She was wonderful.
Was she, in your opinion, ready for kindergarten?
Yes.
I'm going to draw your attention to January 23rd of 2023. Do you remember Cora coming that day?
Yep.
And do you recall who dropped her off?
I do not.
Did you notice anything different about Cora that day?
Yes.
And what was different?
She needed to use the bathroom several times more than she normally would.
And is there a reason why that kind of stood out to you, that she used the bathroom more than often?
Yes, because our classroom did not have a bathroom in it, so we would go down at scheduled times before snack or lunch, and if a child needed to go, one of us would take that child, and that particular day, she went several times extra.
And so between you and Karen, you were kind of taking her more often to the bathroom. Was she complaining of any belly pain or any other issues?
She didn't complain.
But the fact that she asked to use the bathroom was of note to you?
Yes.
And when Cora transitioned that afternoon to go to the sweet pea room with Stephanie, did you pass along those observations to the afternoon teacher?
Yes, I did, because that was something that you would want a parent to know. It was unusual.
And during that morning group, you didn't feel it was necessary to reach out to either Patrick or Lindsay to report that, did you?
No.
But you reported it to Stephanie to pass along for the afternoon?
Correct.
And on that particular afternoon, were you at Learning Sprouts during pickup time?
Yes, I was.
And that wasn't always the case, was it?
Not every day, but I often would help out in the toddler room if they needed me to stay, and that is what I had done that afternoon.
So on that particular afternoon at pickup time, did you have the occasion to see Lindsay Clancy?
Yes, I did.
And did you have an opportunity to speak with her?
Yep, we spoke quickly, and I just was letting her know, and she did already know, but we just spoke quickly that she had gone a few times.
So you were letting her know about Cora going to the bathroom?
Correct.
And how did she respond when you told her that?
She said, I don't remember exactly the words, but basically that she wasn't glad that she wasn't feeling well, but she already had a doctor's appointment the next day so that she would let them know.
And that interaction was fairly brief, correct?
Correct.
But appropriate?
Yep.
And they left that day?
Yep.
Did you notice anything different about Lindsay Clancy after you told her that or in that brief interaction than any of your other interactions with her?
No.
And you are a mandated reporter at the preschool?
Correct.
So if a child were to come in with any concerning marks or bruises or was saying something about things that were happening in the household, you would be required to report those to the Department of Children and Families?
Yes.
Any concerns or reports regarding the Clancy family at all during the time that you were Cora's teacher?
Never.
And do you recall if Cora ever mentioned to you during class, during the time that you were teaching in the morning classes, a time when her mom was in the hospital?
Yes.
And what do you recall about that?
Just that she missed her mom, and she was vocal about that.
Do you remember about when that was, that she said something about her mom being in the hospital?
It was I can't remember if it was in December or January. I just remember that it was said.
But fair to say it was closer in time to the last time you saw her as opposed to the beginning of the school year?
Yes.
Just to briefly go back to Cora's schedule, I know you say you can't remember exactly which days she came, but by January of 2023, Cora was coming for 3 full days and 1 half day, correct?
Yes.
Okay, thank you.
Mr. Reddington.
No questions, thank you.
All right. Thank you, ma'am. Me sit down. Thank you.
The Commonwealth would call Stephanie Williams as its next witness, please.
Okay, so this is when I started my live, so I have zero idea who Stephanie Williams is. We'll all just learn together. The courthouse seems fuller today than in other days. This is the other teacher. Oh my gosh, Jen, get it together. Sorry.
Hey, good morning.
Morning.
I'm going to ask you to speak into that microphone. Keep your
Okay.
voice up. Pull that down a little bit for you. That's it. All right. Counsel.
Thank you. Good morning.
Good morning.
Could you please tell the jurors your first and last name?
Stephanie Williams?
And Williams, that's just common spelling.
Yes.
What city or town do you live in?
I live in Sagamore Beach.
And what do you do for work?
I'm a pre-K teacher
And where do you work?
at Learning Sprouts Children's Center
And where is that located?
in Duxbury.
And how long have you worked for Learning Sprouts?
About 6.5 years.
What age group do you teach?
I generally teach the pre-K children, the 4-year-olds that are going to be turning 5 and going to kindergarten.
And at the Learning Sprouts preschool, fair to say that the different rooms are given a name?
Yes.
Okay. And what room did you work in, or do you work in?
Currently, right now, I work in the Sweet Pea classroom. When I first started there, I worked in the orange classroom.
And I'm going to draw your attention to the fall of 2022, September, into January of 2023. Were you in the Sweet Pea room then?
Yes,
And how many people teachers would be in the Sweet Pea room with you?
I was the only teacher in that room.
Was it a full day program for you in the Sweet Pea room?
Yes.
And were there some kids of that age group, the 4 and 5-year-olds, that would only be there in your Sweet Pea room in the afternoon?
Yes,
Those kids, where would they usually be in the morning?
in the sunflower class.
And fair to say, the sunflower class was more academic curriculum based, and the Sweet Pea room was not in the afternoon.
No, oh, in the afternoon, yes.
So tell us a little bit about what afternoons would be like.
Basically, they would go outside to play. They would be playing in the room. They would take rest time, and then they would get up, have an afternoon snack, and then if there was time permitting, they would be able to play in the classroom or color, do artwork.
And generally, the afternoon kids in the Sweet Pea room, they'd go until 4, right?
Yes.
And that was the time for pickup for most of the kids?
Yes, that's when we close at 4 o'clock.
Okay. Did you know Cora Clancy?
Yes, I did.
And how did you know her?
I was Cora's teacher when I first started at Learning Sprouts when she was 3.
Mm-hmm.
And then she came into my classroom in the afternoons from September to January.
So from September of 2022, when she's still 4, into January of 2023, after she had turned 5,
Yes.
she would come 3 afternoons into your classroom?
It was first 3, then it switched to 4 afternoons.
Now, when she would come to your classroom in the afternoon, what would she be coming into? Is it snack time, nap time, rest time?
Usually it would be getting ready for rest.
And would she be brought to your classroom by one of the teachers downstairs? or at the Sunflower Room?
Yes.
And you're familiar with Susan and Karen as the teachers in the Sunflower
Yes.
Room? Now, how would you describe Cora?
She was a sweet little girl who loved her little brother. She loved to draw, play with babies, play princess. She liked Princess Sophia.
How did you know she liked Princess Sophia?
Because she would pretend to be Princess Sophia, and she always talked about it. And I had actually bought a Princess Sophia puzzle for her.
Now, I'm going to draw your attention to January of 2023, more specifically the 23rd. Did Cora come to your classroom that afternoon?
Yes, she did.
And did you observe anything different about her?
She hadn't been feeling well, and the teachers from the Sunflower class had told me that she wasn't feeling that well.
Did you observe that of her as well?
Well, she did nap, and then she, when all the other children were getting up and getting ready to leave, for the day, she was reluctant to get up off her cot and was still there when her mother came to get her.
Did Cora say anything to you why she wasn't feeling well, if she just felt...
I think she just said her tummy hurt.
Okay. And so you just kind of let her rest for the afternoon? And so who picked her up that day?
Lindsay.
And so normally in pickup, does a parent come to the classroom to pick up the child?
They usually come to the door and we send the child out.
And that would just be the door of the classroom, not the building?
Yes, because I had a door that led outside.
Okay. So on this particular afternoon, Lindsay Clancy came to pick Cora up at the door. And so what, if anything, did you tell Lindsay?
I told her that Cora had napped and she had said she wasn't feeling well, that the other teachers had told me that she hadn't been feeling well and that she was still laying on her cot.
And what did Lindsay say or do after you told her that?
She came into the classroom and picked her up off the cot and said, "Oh, baby, come on, let's go get Dawson and we'll go home."
And so at that moment, when she came to the classroom, she hadn't already picked Dawson up?
No, she went upstairs to pick Dawson up.
And when she came into the classroom and told you that and picked up Cora, did you notice anything different about her than any of the other times you had interacted with her?
No.
In any of the time that you had interacted with Lindsay Clancy from September of 2022 to January 23rd of 2023, did you notice anything different about her?
No, she was just a very loving mother who cared about her children.
And did she share anything with you about her family or about anything that was going on in her household at that time?
No.
And you, as a preschool teacher, are a mandated reporter, correct?
Yes, I am.
So if you were to observe something either on the child or from what the child said or behavior of a parent, you would be required to report that?
Yes, I would.
And as far as the Clancy family went, you didn't notice anything and you didn't report anything, did you?
No.
Thank you.
All right. Mr. Reddington.
Thank you very much.
All right. Thank you, ma'am. May step down. Thank you.
Watch your step.
Commonwealth calls Andrea Hennigan.
Good morning. Can you start right there, raise your right hand, the clerk, please? This way, please. Watch your step, please. You're welcome.
Good morning.
Good morning.
All right. I'm going to ask you to speak into that microphone, keep your voice up so all the jurors can hear you, okay?
Yes.
All right. Perfect. Ms. Sprague.
Thank you. Good morning. Can you please state and spell your name for the record?
Andrea Hennigan, ANDREAHENNIGAN.
And your date of birth?
March 11th, 1976.
What do you do for a living?
I'm a registered nurse.
And where do you work?
Massachusetts General Hospital.
And do you work at any specific department there?
Labor and delivery.
How long have you been a labor and delivery nurse at Mass General?
25 years.
And as part of your training and work in labor and delivery, are you trained in recognizing or helping new mothers who seem to be having issues with postpartum?
Do you mean postpartum depression?
Yes.
I don't have formal training in that area, and I mostly see women before they give birth and immediately afterwards, in the first 2 hours after they give birth. If they come back to the hospital during the postpartum period for a concern, we do screen patients for postpartum depression.
And is that all the nurses that work for the Mass General Hospital labor and delivery unit are able to do those screenings for postpartum depression?
Yes, we ask patients questions about if they're suffering from depression or anxiety, and if they have any feelings of wanting to harm themselves or anyone else. That's a standard admission question.
And if these patients respond that, yes, they are having issues with depression, anxiety, or wanting to harm themselves or others, what do you do with those patients? Do you refer them to somewhere, or do you give them materials? What do you do?
Well, we would talk more about their symptoms with them, and then the first step would probably to be alert the provider who's caring for them, either the doctor or the nurse midwife in our setting, and get social work involved.
Now, while you were working at Mass General Hospital, did you work with Lindsay Clancy?
Yes, I did.
How long did you work with her?
The whole time she worked on our unit, which I believe was 7 years.
And so when you say our unit, she also worked in labor and delivery with you, is that correct?
Yes.
And in addition to seeing her at work, would you also socialize with her occasionally outside of work?
Occasionally, yes.
Directing your attention to after Ms. Clancy gave birth to Callan, which May of 2022, so after May of 2022, did you reach out to her, talk to her in any way?
Yes, I saw Lindsay twice from when Callan was born until January. I saw her in June and in November, and we would send each other text messages.
When you saw her in June, where was that?
That was at her home. I brought some lunch for her and visited with her and the baby, and Patrick and Dawson were home.
And how was Lindsay's demeanor during that visit?
Very good.
Was she her typical self?
Yes.
And how long was that visit for, approximately?
Maybe 2 hours or something like that.
And you said the next time you saw her was in November of 2022, is that correct?
Correct.
And where was that?
It was a restaurant in Hingham. We met for lunch.
And when you met with her for lunch in November of 2022, did Ms. Clancy talk to you about some issues she was having with sleep and anxiety?
Yes, she did.
What did she tell you about that?
During the lunch specifically, I don't remember her exact symptoms. Our conversation surrounded her upcoming return to work, and Lindsay was feeling that she wasn't in a mental state ready to go and take care of patients. She talked about insomnia and some not feeling herself. I believe she might have used the words like brain fog or something like that.
And while you were having lunch with her and having this discussion, did you ever have any trouble understanding what she was saying?
No.
Did she ever appear to have difficulty understanding what you were saying in response?
No.
Was there anything different about her speech pattern?
Not that I recall.
when you were discussing these issues with Lindsay about having some insomnia and being concerned about going back to work, did you give her any advice or do anything to help?
Yes, it was myself and 2 other nurses that we work with who Lindsay was friends with outside of work, and we were all encouraging her to get the help and support that she needed with medication if needed and therapists, and giving her any ideas we could think of in our personal and professional lives that may help her.
Okay. And did Lindsay tell you that she was looking to find some type of medication that would help her sleep and help her with her anxiety?
Yes, I believe we talked about medication, and she was going to be meeting with a new therapist shortly.
And during this conversation or after it happened, did you ever have any concerns about her harming herself?
No.
Did you ever have any concerns about her harming the children?
No.
Did you give her some names of obstetrics or social workers?
I did. After our lunch, I recall that I reached out to another friend of mine who had had a pregnancy loss that was challenging for her and had met with obstetrical specific social workers and support groups, and I asked that woman, could you share those names, and I sent them to Lindsay.
Okay. Did you have some text messages between yourself and Lindsay around Thanksgiving of 2022 in which she told you about a program she was going to try?
We did have text messages around Thanksgiving. I believe the program you're referring to was something that her mother-in-law had told her about at South Shore Hospital that was more specific to perinatal issues rather than a general social worker, someone who specialized in this area.
What does perinatal mean?
During pregnancy, birth, and after birth.
So this was a program more focused on women either during their pregnancy, while birth, during birth, or right after birth, as far as you know?
I mean, as far as I understood it, I just understood it to mean someone who was familiar more with postpartum depression or anxiety, was my understanding.
Okay. And did you also receive some text messages from Lindsay Clancy right after New Year's on January 2nd, 2023?
Yes, I did.
And can you tell us what that exchange was?
Again, that was with myself and Lindsay and the 2 other nurses who she had confided in, and we asked her how her holidays were and could we get together again in the new year. And she said, I can't get together right now because I'm involved in an intensive program, but hopefully soon.
Okay. And did she wish you a Happy New Year?
She may have, I do not recall.
And did she tell you that she was in fact at that time at McLean Hospital, or did she just leave it more vague that it was just an intense program?
I believe it was an intense program. I did not know the name of the facility at that time.
Did you at that time know that she was currently at a hospital?
I don't recall what I knew then versus what I know now.
Did you also speak with Lindsay on January 23rd, 2023?
I did not speak to Lindsay. I sent her a text message on January 23rd.
And what did you say in your text message?
I'm paraphrasing, but I believe I said, hi, I've been thinking of you, wondering if you're still in the daily program, I believe I said, so maybe I didn't realize it was inpatient. And she responded.
And what was her response?
Again, I'm paraphrasing, but she said something like, I'm no longer in the program. I'm continuing to work with my psychiatrists to find the right medication that will allow me to sleep at night but still function during the day. I've had a lot of
bad or negative side effects from the medication, so I've had to come off of them and go on new ones, and it's been very difficult.
Okay.
Or has taken a long time or something like that.
Okay. And after those text messages that were exchanged on the 23rd, did you have any concerns that she was going to harm herself?
No.
The tone of the text messages, were they more positive and hopeful that things were going to work out on the right medications?
I don't know that they were more positive than previous times. I believe that Lindsay was always hopeful that she would get the care that she was seeking, so I don't know that the tone was different that day.
But it wasn't a negative tone, it was that same kind of hopeful tone?
Yes, as far as I remember.
Thank you.
Thank you.
Katrina Reddington.
Morning.
Good morning.
So even during the, let's say, the difficult times that she had, she was always trying to be hopeful and always tried to have a positive outlook on her health.
That was my impression, yes.
And you obviously are a good friend.
Yes, I believe so.
And you've known her for what, 7 years? 9 years now, right?
Yes, I believe since 2015, if that's when she began working at Mass General.
Right. So she was like a 24-year-old kid when she first started there, right?
Yes.
And you basically knew her right out of nursing school, all the way up through,
yes,
till she finally had the baby, the last baby, right?
Mm-hmm.
Can you tell us, what was her work ethic? Was she a good nurse? Was she a caring nurse? Tell us what your observations were. Granted that you're a friend and you might be biased, but tell us what you thought.
Yes. Lindsay loved being a nurse and was excellent at it. It was a second degree for her to go to nursing school. And you could tell with Lindsay it was more of a calling, that she really cared so deeply, specifically about caring for pregnant women and women giving birth. She was very attentive to all of her patients' needs. She was very smart, and mostly she was incredibly nurturing and caring.
Thank you. And during the period of time in the fall of 2022 up through Thanksgiving of 22 and then into 23, you obviously, as a good friend, stayed in close contact with her, texting, seeing her, dinner, lunches, and everything, right?
Yes.
And then when you and some of the other nurses would go to a lunch, for example, if I understand correctly, on one of the luncheons that you had in the fall of 22, she was telling or sharing with you the fact that she was going through a difficult period.
Yes.
Told you that she was not in a good mental state, that she had a lot of insomnia, and she even described it as brain fog, right?
Yes, I believe so. She definitely used those words in our text messages, as the fall progressed, but I believe she used those words during the lunch. She definitely said that she was in a difficult mental place and didn't think she'd be able to go back to work.
And she told you that she was actually actively treating with medical personnel. Did she say a psychiatrist, psychologist, or just seeing doctors, or what did she say?
Yes, she talked about therapists. She talked about going on medication. At some point in that month of November, she said she had even gone to the emergency department.
Did she tell you that she was having negative side effects with the medication that she had been prescribed by these doctors?
She did. She did not elaborate on the side effects, but she did say that multiple times.
So as close as you were for all those years working together, and you guys worked together through the COVID too, right?
Yes.
Is that a bonding experience for nurses?
Yes.
During that period of time, did you ever observe her? Was she a complainer? Like, would she come and complain to you, or was she pretty much private but would share her opinions of what was happening inside of her with you?
She was not a complainer about work or home or anything. But we were friends, and she did share more personal details with me.
And when she was working, would you guys be working on the night shift, or would you work in the afternoon? Or
The night shift.
night shift. So did you ever see her go on her phone and access cameras to see what was going on at home with the babies or anything like that?
Yes.
Is that something that she would do on a regular basis, staying in touch with the family and looking at the cameras?
Yes.
Did she ever tell you why she was doing that?
Not specifically.
Okay. But she, to your appearance or to your observation, appeared to be very concerned about her kids, right?
Yes.
Did you ever hear her complain that she wanted to leave behind the life that she had and basically move on, something better?
Oh, no. Lindsay, from the time I met her as a young woman, very much desired to be a mother and have a family.
And she did share with you that her mother-in-law actually referred her to somebody for some help as well, correct?
Yes.
In the holiday period, you guys stayed in touch again. You were texting her, and that's when she was, now we know she was in McLean Hospital, but she told you she was in an intensive program, right?
Correct.
In other words, she didn't say, I can't go to lunch with you guys because I'm in a mental hospital. She basically said, I'm treating my problems.
Correct.
To your years of dealing with Lindsay and seeing her with her kids and her family, what's your opinion of her as a mother?
Lindsay was a very loving, caring mother. This is exactly what she wanted to have. She wanted a big family. She was happy to have her children close in age.
Thank you.
Thank you.
The redirect?
No, Your Honor.
All right. Thank you, ma'am. Please step
Thank
down.
you.
Watch your step, please.
Commonwealth calls Bethany DeCalvis.
Okay, a couple of things. First, I want to say to Sarah, babe, your plate is so full, but I'm got my fingers crossed for good juju for your surgery tomorrow. Please keep us updated as you can. Obviously, we're not a priority over here. You are the priority. So we'll be thinking of you. Hope everything goes great. I'm sure it's going to work out just great. Then to Shmita, happy birthday, Noxie Lopayer. Can't believe you're 2 already. I remember when you were literally the size of a pear. So there's that. Also, yes, they did, Maria. Only one. We'll get to. I'll get you caught up. Just give me a second. So, a couple of things really stood out to me with her testimony. Lindsay confided in her, and I think that her going to other nurses for help. They were friends, but they're nurses, and like my dad's a nurse and he's retired now, but when he was working, if things came up that I wasn't sure about, and my mom too, I would go to my mom and my dad because they have, medical knowledge. So I would go to them. And I probably would have gone to them anyways, even if they didn't. But still, you feel a little more reassured when you're confiding in someone who has medical expertise. And my mom and dad were always really good about saying to me, "Hey, this out of my scope. You got to speak to a doctor." And they would really encourage me. You need to see a doctor for this. Anyway, so I think that's telling. I think that the fact that she was expressing that is indicative of her really trying to get help, really trying to get these issues resolved. And the problem is especially when she was telling her friends that, she was trying to find the right combination of medications that would alleviate her mental health issues, her insomnia, but still leave her able to be fully present and able to function to take care of the children. Well, I think it cannot be stated enough that all of the SSRIs that she was on all have the side effect of drowsiness. And so when you're taking those medications, especially when your body is trying to get used to them at first, if you take them at night, the thought is that you will sleep and sort of wake up and not have any residual drowsiness, but that's not always the case. Also, some of the medications, specifically the SSRIs that she was taking, tell you to take with food. So trying to find the right combination, when to take them, that and knowing that they all have a side effect of drowsiness. It's not, like I said, it's not like when you take those medications, you don't you don't wake up and sometimes have that residual sort of out of it foggy feeling. That does happen, quite frankly, a lot. And there is this as well, Shmita. There is a side effect warning for it's the Zoloft, particularly, that I know for facts, that do have the Wellbutrin is another one that has the side effect of potentially increasing suicidal thoughts. So it's, this is not like treating mental illness is not like going to the doctor for strep throat and they put you on an antibiotic. There is, it's more specialized than that, and it takes time to find the right medication at the right dosage. There's many variables, but in the hardest time is that interim period when you're trying to figure it out. And that's when things can go horribly wrong. That being said, I don't understand how I understand. I would understand if these witness, especially the nurse that just took the stand, would have been called by Lindsay's team, but I don't understand the Commonwealth calling her. The daycare workers were not helpful in one way or another to the state. They neither helped nor hurt the state. Maybe slightly hurt the state, only because they testified that they never saw anything that would cause them concern in their capacity as mandated reporters, that she was a good mom. And so I don't know. I have not, the state, this is still the state's case. When it's no longer the state's case, the thumbnail will look the same, but I'll change it. And I'm going to add to the thumbnail that, if this is the state's case, that way, or maybe to the title. Crazy Mama said, hi, by the way, you can swab for strep, etc. You can't swab for mental health, unfortunately. It's just a guessing game as far as treatment. Exactly. And it relies heavily on what the patient is reporting, how they are describing their symptoms. And so, if Lindsay is telling her providers, listen, I have insomnia and I need a sleep medication, I need to be able to sleep, but the sleep medications you've given me thus far, I'm waking up still feeling out of it, foggy, detached. What else can we try? I mean, there's only so many medications out there, you know? And I'm sure she felt scared to take anything that left her feeling that way in the morning when it's time to take care of the children. You just, you know, you don't want to be feeling like that when you're responsible for the safety and well-being of your children, whether they're your own or somebody else's. Ooh, sounds fun, crazy mama, to be going camping.
Watch your step, please.
All right, good morning.
Good morning.
Counsel?
Thank you. Can you please state and spell your name for the record?
Bethany DeColibus, BETHANY DECOLLIBUS.
And your date of birth?
6/29/89.
What do you do for work?
I'm a licensed marriage and family therapist.
And do you have your own practice?
I do have a private practice.
How long have you been in this line of work?
I've had the private practice for about 6 years, but I've been licensed for close to 12.
And in your practice, do you do in-person therapy or telehealth therapy?
I do telehealth therapy right now.
Do you know Lindsay Clancy?
I do.
How do you know her?
We were friends, met as new moms in the same town.
Would that be Duxbury?
Yes.
And how often would you see her?
I'd say probably weekly.
And where would that occur?
Our kids were involved in similar activities, music classes, gymnastics classes. We'd schedule play dates.
What was her typical demeanor?
She was active, engaged, friendly.
Did you ever notice any distinctive changes in her rate of speech or the way she spoke?
No.
Did you ever see any extreme changes in energy or weird behavior?
No changes in weird behavior, but I did notice that she appeared more tired.
I'm sorry, I didn't hear that.
Could you repeat that?
You could state that.
Tess is going to be mowing. I hear you, babe. I appreciate the update and good luck on the mow. Yes, be good for Shamita. You guys don't give her no troubles.
Again.
Oh, I was answering the second part of your question. I didn't notice any changes in behavior, but I did notice her appearing more tired over time.
And was that after she had Callan or before that?
Afterwards.
And how often would you see her after she had Callan?
Weekly.
So still going to the same types of places where you would run into her and engage with her. Is that correct?
Yes.
And other than seeming more tired, was there any other change in her demeanor or personality or behavior?
No.
So since Tess is listening, I'm just going to read this to her. Shakto says to you, Tess, you mow lawns too? What? Sandwich maker, lawn mower too. Wow. So cool. I know, Tess out here making us look like slackers. She makes her own bread for her sandwiches as well, Shakto. You should know that.
Did she tell you during that time that she was having trouble sleeping?
Yes.
And did she give you any specifics on that?
Just that it was very difficult to get sleep, difficult to fall asleep even when kids were asleep, and that it was just it was an ongoing struggle.
Did that cause concern for you at that point?
I think for a period of time, it felt normal, but after it seemed to continue and not let up for her, I definitely worried about her and was concerned.
When you say it seemed normal, what do you mean by that at first?
I would say for a period of time seemed reminiscent of, sleep troubles that, I remember having and that, remember friends talking about. But I think over time, I started to worry more and realized that it wasn't improving for her.
And what you're talking about, is it, typically after having a baby, new moms are tired from, late night feedings and changings and all of that?
Yes.
And then with Lindsay, she stayed tired?
Yes.
Okay. Did she talk to you about seeking out help from doctors?
She did.
And did she talk to you about seeking out medication to help?
Yes.
And do you recall any specifics about those conversations, about what types of doctors or what types of medication she was seeking?
I don't know about the different types of doctors or the types of medications.
Did you ever talk to her and she relayed that she was looking to find a therapist?
Yes.
And do you know if she ever found a therapist?
At some point, it did sound like she had found a provider to work with.
Being a therapist yourself, did you ever offer to give some referrals or anything like that, or did she ask for any?
I can't remember.
And you said that she continued to appear tired, correct?
Yes.
But other than appearing tired, as the weeks went by, did you observe her and having any problem interacting with people or doing the typical behaviors that you would do at the events you would usually see her at?
No.
Did she appear to have any trouble doing day-to-day tasks or interacting with anyone?
Not that I saw.
Did she ever tell you that she was depressed or suicidal?
No.
Did she ever tell you that she had thoughts of harming anyone else?
No.
Did her physical appearance change in any way?
Not that I noticed.
When you would engage with her, have conversations with her, were they usually in person or text or both?
It was a mix of both.
And did you ever have trouble understanding her, either in person or in a text?
No.
Did she ever appear to have trouble understanding you?
No.
At some point in time, did you have dinner with Lindsay and a woman named Erin Renault sometime in November?
Yes.
And was that something that the three of you typically did?
Yes.
How often would you do that?
Probably once every couple of months.
Was this the first time you'd done that since Callan was born?
I can't remember.
Okay. And what was Lindsay's demeanor during that dinner?
She was engaged in conversation with us.
Do you recall saying previously that she seemed normal?
No.
You don't recall saying that?
Not specifically, no.
What about her speech pattern? Was there anything different about her speech pattern?
No.
Well, hold on a minute.
What did you guys talk about?
Wait a minute. Back the milk truck up. I don't know why the Commonwealth has chosen to call this witness and to speak on her observations when, and I'm not trying to be ugly here, but I don't know another way to say this. There have been other people who have testified that Lindsay lost quite a bit of weight, and yet she said that she noticed no physical changes. How can that be? So if I'm on the jury, and let's pretend that I am, I'm thinking this woman is not very observant. That's just me. Still doesn't move. First of all, she's a friend. Yes, she's a professional therapist, right? But it's not like, she can't treat her, and I do know from having people in my life that are in their professional lives, therapists, psychologists, I know doctors, I know nurses, And the thing they complain about most is whenever they're in a social setting, people seem to come up to them, particularly doctors, and they want like an examination, or they want to talk about what's going on with them and get their opinion. And when those types of people are in a professional setting, they frequently just want to be a human and enjoying a social setting, not a doctor in a social setting.
During that dinner?
I remember catching up as we usually did, giving each other updates on, what our kids had been up to, what our families had been up to. And I also made it a point to check in with her about how her sleep was and how she had been feeling lately.
And did she give you responses to those questions?
She did.
Did they make sense?
The responses made sense.
Yeah. What was the tone of this conversation?
I'm not sure how to answer that question.
Well, when you're asking her about how things are going with her sleep and other things, and she's responding, does she seem negative and depressed about things? Does she seem hopeful about things? Like, what's the tone?
It was a serious conversation. I was concerned and wanted to check in. It had sounded like she had been able to connect with some providers, and I would say at that point, I remember her expressing feeling hopeful about the possibility that things could start to get better.
And during this conversation at dinner, did she ever mention that she had suicidal thoughts?
No.
Did she ever mention that she had homicidal thoughts?
No.
Did she ever tell you that she was hearing voices?
No.
Did she ever tell you that she was having intrusive thoughts of her own?
No.
At any point in time while you're engaging with her, did it look like she was responding to something internally, like a voice, or seeing something that wasn't there?
No.
Other than having an issue with sleep, did she mention any other issues that she was having?
She mentioned feeling anxious.
And after this dinner, did you next see her at Cora's birthday party in January?
Yes.
And at that birthday party, did you see her interacting with other people and parents and children, as a mom would usually do at a birthday party?
Yes.
Did you interact with her yourself?
I did.
Did you notice anything different about her demeanor or her behavior at that party?
No.
Did you have a conversation with her briefly about sleep?
I did.
And was it you basically asking how the sleep issue was going?
Yes.
And what was her response?
She responded that things haven't gotten any better and that she feels like a zombie.
Was there anything about her appearance or the way she was interacting or behaving that when you saw her, you thought she looks like a zombie?
She seemed tired.
But there's a difference between being tired and looking like a zombie, right?
She didn't look like a zombie, no.
And what does a zombie look like? I mean, this is your witness, Commonwealth. Why are you arguing with her? Because she's not saying what you want her to say? Right, Neat. Are they implying that if Lindsay Clancy didn't tell her, it didn't happen because she didn't report every single thing ever to her friends, who she had friends that worked professionally as nurses, and this one is a therapist? This is ridiculous. Coffee and Skeletons. Hi, by the way, says Shepto, my cousin absolutely loves Megadeth so much that he went to a meet and greet with Dave Mustaine. The reason I'm commenting on this, and this is just a sidebar, but hey, if the court can take 11 billion sidebars, I can take one, right? I just would like to point out for the record that the friendship door between everybody in Metallica, all the band members in Metallica, the founding band members of Metallica, and Dave Mustaine of Megadeth, the friendship door is still closed because the other day I was scrolling the tubes, and you know how you'll get a you'll see like community posts or whatever. Well, Metallica posted a picture of Dave Mustaine and asked who it was, and they only wanted wrong answers. They do it all the time. They're petty AF. That is all.
And she was able to engage with you, and the other parents there engage with her children and the other children, correct?
She was.
And do you recall stating previously that at the party she seemed fine?
And no, not specifically.
Page 11. Have you look at page 11 and bottom line 24, and then to the top of page 12. Does that refresh your memory as to a conversation you had with the police back in 2023 where you said that she seemed fine at the party?
Sure, yeah.
I have no other questions, thank you.
Mr. Bennington.
So, morning.
Morning.
Fair to say that you were obviously pretty good friends with Lindsay?
Yes.
And fair to say that in that regard, you had occasion to observe objectively things like she looked tired, she was complaining that she was tired.
Yes.
Said that she was anxious.
Yes.
Told you that at one point towards the end time frame into January that she felt like a zombie. Correct?
Yes.
Did you ask her any questions like the district attorney was asking you? Did you ask her, well, what are your symptoms and what do you feel like? And what do you know, is there anything that you can tell me about how you feel? Did you probe in that regard?
I don't remember probing about specific symptoms, no.
So in other words, you're friends, and you and Erin and Lindsay were out to dinner or lunch, and you're trying to have a good time, right?
Yes.
How was she as a mother to your observations? Did she, as far as taking care of her kids, being happy with the kids? Did she not like her kids? What were your observations?
She loved her kids. She was warm, kind, consistent, loving.
And you actually were summoned to be here today by the district attorney's office, correct?
I was.
And you actually were interviewed by the state police. That's what she was questioning you about, page 11 and page 12. It was a recorded interview and things of that nature, right?
Yes.
Would you agree with me that although she may not have been telling you that she was seeing something that wasn't there, or hearing voices or drooling or acting in some unusual fashion while you guys were out having lunch, she did express to you that she was having some difficulties, correct?
She expressed that she was having difficulty, yes.
And would you say, knowing Lindsay as you did, that she was the type that was not really a complainer? She would not try to be a downer when you're out to lunch and having a good time with your friends and complain about her symptoms?
No.
But she did tell you that she was somewhat hopeful because she was seeing healthcare providers?
Yes.
And one of the things that they had asked you about, fair to say that when you talked to the police, you told them that you had spent a lot of time chatting about over this period of time that she had been having a lot of trouble sleeping, and that she referenced the postpartum period, right?
Yes.
And when you were talking to the police, the troopers, did they try to divert you? Did you feel that they were trying to get what your observations were, or did they want you to focus on their questions when they were questioning you?
Could you repeat
No, it's
that
a bad question. Never mind. It's a bad question. I'm sorry. But nevertheless, you actually told them that you had been in touch with her. You'd been to the house, right?
I had been in touch with her, yes.
Yeah, and you knew Patrick.
Yes.
Other than socializing with your friends and with Erin and going out to lunches, you guys would also text, correct?
Yes.
I mean, that's a way of keeping in touch with each other.
Yes.
And she would respond to your inquiries about fun things and about kids, right?
Yes.
But also, on occasion, you were concerned about her and you'd ask her how she's doing, right?
Yes.
And when you would ask her those things, she would tell you, for example, that she didn't know what medications were doing to her, but she in fact mentioned to you that the medications did not appear as though they were helping, and she still wasn't able to get any sleep.
Correct.
And further, in the statements that you gave to the police when they were asking you questions about your observations, she did indicate on a couple of occasions that she had obtained a therapist and a prescriber, and she would reference her relationship with Pat and tell you that Pat's great, things like that, right?
Yes.
You said yes, I'm sorry, the door
Yes.
closed. So in those occasions, did she ever complain about Pat, or would they seem to be getting along pretty good?
They seem to be getting along great.
Was he supportive to your observations of her?
Yes.
Then when you went out to the other dinner, did you indicate to the police that in that conversation that her mother knows everything, or she told you my mom knows everything, and she's working it out as far as the therapist and the drugs, correct?
Yes.
And you still felt that it was readily apparent that she was struggling, right?
Yes.
Still having difficulty sleeping and being anxious, right?
Yes.
And as a friend, you were concerned, right?
I was concerned. Yes.
Now, one of the questions the DA had asked you is that she was supposed to go back to work, and that she indicated that she had canceled that date to go back to work because she still wasn't sleeping well. Is that right?
She had, yes.
And those were her words, that she canceled going back to work because she still wasn't sleeping well.
Yes.
Did she ever talk to you about work? Did she seem to like her job as a labor and delivery nurse?
She loved it, as far as I knew.
And then you were at Cora's birthday party in January, is that correct?
Yes.
And that was the one that was at the trampoline park, right?
Yes.
And it was that time, and that would have been in January of 23, I believe, that it was in that time that you were concerned and you said, hey, are you getting any sleep? And she was like, no, I feel like a zombie, is what her words were, correct?
Yes.
Was that the last time you saw her?
Yes.
Thank you.
Any redirect?
No, Your Honor.
All right, thank you, ma'am. You may step down. Counsel, why don't we take a brief recess at this time? So we're going to take the morning recess at this point.
We already had a morning recess, Your Honor. What are you doing?
All right.
Now, I will say this with that last witness on cross. I believe, I don't know what the Commonwealth was thinking calling her, really. Because somebody's saying, how did she appear at that party? And you respond with fine. Obviously, as you guys have been talking about in the side chat, fine is subjective. But she has reiterated multiple times now that she was concerned. That she was concerned because this was beyond the tiredness that a mom feels after the birth of a child. You know, once this was beyond that, and it lasted longer than that, and that it lasted beyond the new baby phase. You know, by the time, so when for me, most moms, I think, would say that the first 3 months are the getting to know you phase, right? Between you and your baby, you and your newborn, and you're learning about what works for the baby, what doesn't work for the baby, the best schedule to have them on, all of those things. And about the 3.5 month mark, you're kind of working that out. And they're starting to sleep for longer intervals, you know, barring any, you know, thing that's going on. Some babies are just better sleepers than others. So what she's testifying to is this went beyond that. this was more than just, you know, a mom with three young children adjusting to a newborn. It went beyond that, and it went on longer than that, and it didn't seem to despite her continuing to go to her reporting that she was speaking to providers and trying to work on things, she still noticed that things were not really in the sleep department improving for her. So I don't think, hey, Ava, I don't think that this witness was at all beneficial to the Commonwealth, and I don't know why they called her. And beyond that, yeah, I'm just going to leave it there. I think that's good. I think I made my point. Lumen B says, has the prosecutor never heard of masking? Duh. I think that they likely have heard of masking, because remember now, they have access to all of the reports from Lindsay's experts evaluations, and I would imagine that word is in there. But what I think is they don't believe it. I mean, one of the things that they have alleged, the Commonwealth, is that Lindsay wasn't seriously seeking help for mental illness, that this was attention seeking. And the evidence of that is pill counts.
Very accurate.
Exactly, Catherine. Catherine said far beyond that. I am just not happy with the Commonwealth creating this narrative that nothing was wrong. I think it is plain as day. I don't understand their tactic here. Like, I don't understand, not their tactic. I know exactly what their tactics are. Emotional manipulation. But what I don't understand is their trial strategy, right? To me, it would seem they should spend less time focusing on some of the things that they're focusing on and get down to the nitty gritty of it all. Get your mental health experts on the stand. That's who the jury wants to hear from. That's who they need to hear from. That's where your energy, I would think, in this case, for this trial, would be better focused. Obviously, there's the normal stuff that goes on with the trial that is, perfunctory. Like, you do have to establish that the people in the charge are deceased and that the manner of death is homicide. Okay. That the I dotting and the T crossing, keep that to a minimum and get that as expedited as you can in an effort to get the professionals that the jury really needs to hear from up on that stand. I don't know I don't agree with this trial strategy. And if I had to Google review the trial strategy thus far on day 8, 0 out of 10 would not recommend.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial.
Your Honor, for the purpose of the record. Oof. ADHD playlist says, you are a very wise woman, Jen. I love hearing your input on these cases. Thank you. And Ava, she absolutely is. Well, I appreciate that. Crazy Mama says, for the most part, when you're in nursing, you ignore a lot of signs for yourself health-wise. You don't take care of yourself like you do your patients, in my opinion. Yes, I mean, there is an old adage. It's not so much, the adage doesn't say nurses. What it says is physician, heal thyself. Because I think when you're in the medical field, period, where you are responsible for patient care, you tend to take much better care of your patients and, sort of encourage, some might say nag, them to, you need to get in, you need to get seen, all of the things, right? And you got to take care of yourself. And if you don't take care of you, who's going to take care of you, right? They encourage that in their patients, and they don't practice that at home. Sometimes when you're taking care of other people, you have very little left for yourself. Oh, Shakto, thank you. Jen is brilliant. I don't know if I'd go that far. I have an occasional moment of saying something smart. No, I'm just kidding. Thanks, you guys. I appreciate that. You're very complimentary on this Thursday morning, and I appreciate that.
The Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Everyone, thank you. Commonwealth, call your next witness, please.
Thank you. Commonwealth calls Amy Bevins.
I believe this is another friend who's clearly nervous about being here today. Poor thing, wringing her hands. I hate to see that.
Stop right there. Raise your right hand for clerk, please.
Listen, crazy mama, listen, like physically, I actually have a small head, and if it did grow 2 sizes, it would be okay. Then it would just be in the normal range. It wouldn't be small. And the thing of it is, like, this is why I fuss about my weight so much, because if I gain too much weight, because this happened when I was pregnant, and like when I didn't lose the baby weight immediately, because I have a little head on a big body, it looks like a turtle. I do. I'm not even lying. I've looked at pictures of myself and I'm like, oh my God, I'm in full on turtle mode. All right, here we go.
Watch your step, please.
All right, good afternoon.
She's nervous.
Give me that microphone. Keep your voice up.
Oh, bless her heart.
All right. Tree spray.
Thank you. Good afternoon. Good afternoon. Can you please state and spell your name for the record?
Amy Bevins, AMYBEVINS.
And your date of birth?
8/22/90.
Do you live in Connecticut?
Yes.
What do you do for work?
I'm a licensed behavior analyst, but I specialize primarily in early intervention for young children with autism.
If you could just keep your voice up a little bit, maybe come a little forward to the mic. How long have you been doing that?
6 years. I was a special education teacher before that for a long time as well.
Do you know Lindsay Clancy?
Yes.
How do you know her?
We have been friends for almost 29 years.
So you met her when you were children?
Yes.
Did you go to school together?
Elementary school.
And after that?
All the way up through middle school and high school as well.
Okay. And did you keep in touch with Lindsay when you went off to college?
I would just like to point out that when the friendship has ended, usually when somebody's testified in trials we've watched before, they would say we were when asked. They want to emphasize that they're no longer friends. They answer beyond the actual just simple yes or no. She didn't do that. And she's incredibly nervous. And she was looking over in Lindsay's direction. And it's so much so that when the prosecutor started asking her questions, you could see that from the demeanor of the witness that she was kind of having to, like, the prosecutor was trying to get her to focus, look over here at me. So I think that I have great compassion and empathy for this witness, because this must be incredibly difficult circumstances. There'd be no good circumstances where you're called as a witness to testify against your friend, period. then you add on what the charges are in this case, that would be also incredibly difficult. And I would imagine that her friends and family are feeling a lot of survivor's guilt, or it's not technically, it wouldn't really like under the implicit definition of survivor's guilt be survivor's guilt, but kind of in a way it is. I'm sure they're going back through their heads and their minds and replaying all of the interactions in the critical time period and wondering, did I miss something? What did I miss? Could I have stopped this? Could I have changed this? How could I not see it? You know what I mean? How could we not have helped her? How could we not have helped her so that this didn't happen, so the kids would still be alive? I would imagine all of her family and friends are doing that.
Yes.
I'm assuming you didn't go to the same college, right?
No.
Do you know where Lindsay went?
Quinnipiac University.
And how did you keep in touch?
Through texts, phone calls. We visited each other at each other's campuses.
And then when Lindsay went to nursing school, did you still stay in touch at that point in time?
Yes.
And how did you do that? The same way, like text visits?
Yes. I also lived in Boston at the same time that she was in nursing school up in Boston.
Okay. So was your contact more frequent while she was in nursing school versus when she was in college?
I can't remember the exact amount of contact, but I would say we were always in contact together, yes.
Okay. While Ms. Clancy was in nursing school, did she ever tell you that she was taking some mental health medication?
I can't recall.
Did she ever tell you that she was struggling with anxiety or anything like that while in nursing school?
Nothing that I can recall.
And after she was finished with nursing school, did the two of you still remain in touch?
Yes.
And how often would you see her?
I moved back home to Connecticut, so whenever she was able to visit home, we would stay in touch. I traveled to Boston, not very frequently, but I would visit her there as well.
And did you have a text chain going between the two of you?
Yes.
And did you also have a group text with other friends from Connecticut that you both grew up with that you would participate in?
Yes.
And how often would you text with Lindsay?
Pretty frequently. It depended on, I think, the point in life that we were at, but I would say there was regular communication.
And growing up with Lindsay and knowing her into adulthood, how would you describe her general demeanor?
She was pretty a calm person. She was nice and had a very calm approach to herself.
And during that time that you knew her and would interact with her, did you ever notice any changes in her pattern of speech or rate of speech?
No.
Was she pretty consistent in her behavior and speech patterns throughout the years that you knew her?
Yes.
After Ms. Clancy had Cora, were you still in contact with her at that time?
Yes.
And just to kind of get it out of the way, were you in contact with her all the way up through January of 2023?
Yes.
Okay. And so after she had Cora, did you notice any changes in her demeanor?
No.
Did you notice any changes in her behavior?
No.
Did you notice any changes in her speech patterns?
No.
After she had Dawson, did she talk to you about that delivery and how that went?
Yes.
And what did she tell you about that?
That was more of a difficult delivery than the one she had with Cora, that she would maybe need to take some time to recover prior to thinking about having a third child.
And during that time, after she had Dawson, did you notice any changes in her behavior?
No.
Or her demeanor?
No.
Her speech pattern?
No.
Was there anything about your interactions with Lindsay during that time that caused you to have concern about her harming herself or someone else?
No.
And then after she gave birth to Callan, did you notice a change in her demeanor at that time?
No.
or her behavior or rate of speech?
No.
Did you see her in Connecticut in November of 2022?
Yes.
And why did you see her then? What was happening?
She had traveled down to Connecticut. We had gotten together as a group to go out to breakfast.
And had she come to Connecticut alone or with her family?
Alone, I believe, at that time.
And you said you went out to breakfast?
Yes.
Was this with that whole group of friends and spouses and everyone that kept in contact from Connecticut?
Yes, there was a group of us there that had all remained friends.
Did you notice anything about her demeanor or behavior at that breakfast in November of 2022 that caused you concern or was different than her typical behavior?
No.
Did you have some text conversations in January of 2023 about some issues that Lindsay was having?
Yes.
And do you recall when those messages started?
I don't recall the exact date of the messages, but it was only, I believe, one night.
And in terms of what happened on January 24th, 2023, how close in time was it to that?
Can you repeat the question? I'm sorry.
So in terms of January 24th, 2023, when the children were killed, how close in time were your text messages to that incident?
Only a few days.
Okay. And what was that text conversation?
She had shared that she had been taking a medication that caused her to have some dark thoughts, but that she was going to, or had been tapering off that medication and was trialing new ones that would remove those side effects and be more helpful and therapeutic to what she needed.
And did she tell you what those dark thoughts were?
No.
What was the tone of the conversation?
Hopeful, I would categorize it. I remember it being something where there was conveying of hope and that it was going to be we were moving in a positive direction.
So basically, would it be fair to say that Lindsay was telling you that she'd had some side effects and some dark thoughts because of medication, but was weaning off of those and moving on to something else that would hopefully help her?
Yes.
Did she ever express at any point that she wanted to harm herself?
No.
Did she ever express that she wanted to harm the children?
No.
Did she ever tell you that she was hearing voices?
No.
Other than saying that she had had some bad thoughts, did she say anything else that was concerning in that conversation?
No.
I want to direct your attention to March of 2023. Did you visit Ms. Clancy while she was at the Spalding Rehabilitation Facility?
Yes.
And how was that arranged?
At the request of one of her family members who reached out to see if I would like to come visit.
And you traveled to Massachusetts and visited Lindsay at the Spalding Rehab Center, is that right?
Yes.
And what did you do there with Lindsay that day?
We made small talk. We played Uno. It was a pretty basic visit.
When you say you made small talk, what did she talk about?
I remember her asking about my daughter. I remember her asking about any updates to life events for our friends. We talked about some hobbies that she was doing while at Spalding and then played a game.
Do you remember what hobbies she was doing at Spalding?
I can't recall specifically, no.
At any point in time, did she mention the death of her children?
No.
At any point in time, did she break down in tears and cry about her children?
No.
What was her affect during that meeting?
I don't remember exactly. Pretty neutral, I would say.
Did she attempt at any point to harm herself?
No.
Did she ask you for help in harming herself?
No.
Did she talk about Cora Dawson or Callan at all?
No.
I have nothing further. Thank you.
Mr. Reddington.
Afternoon. You're nervous. Don't be. Okay. You guys go back how far?
Almost 29 years.
And over those 29 years, knowing Lindsay when you guys were in grammar school, I guess, and high school, and then you went off to college, and you had your families and your marriages, tell us what your opinion was of her as a person.
I knew her as a good person, a good friend, a good mom.
And you had occasion to see her with her kids and how she acted with her kids, Cora, up till Callan?
Yes.
And did you ever observe anything out of the ordinary, or did she appear to be a loving person and taking care of her kids?
I never saw anything out of the ordinary.
District Attorney asked you about the visit that you had when you were good enough to visit with her at Spalding Rehab. And this was when, in March of 23?
Yes.
And arrangements had to be made for you to visit with her. You had to get approval, and whether you know or not, I mean, I had to kind of help you out a little bit trying to get through the red tape to get in there to see her, along with her family approval and that type of thing, right?
I don't recall any of that.
But you were able to get in?
Yes.
To visit with her. And this would have been in the beginning of March, if you know, the middle of March, the end?
I don't recall the exact time.
Was she able to walk around and ambulate, or was she in a wheelchair, or what was her condition? Was she in bed?
She was in a wheelchair. She was sitting up the entire visit.
Did you ask her about why she was in the wheelchair and anything like that?
No.
You knew that she had been in the hospital from January 24th, right?
Yes.
And you knew that your friend had been charged by the police and had killed her 3 beautiful children, right?
Yes.
That was a bit of an awkward, uncomfortable topic, wasn't it?
I think it would be for anybody, yes.
Absolutely. And the district attorney asked you whether or not she cried and whether or not she told you about her children and anything to do with her children or that incident. You both basically stayed away from that entire subject, right?
I remember also being told not to bring that up specifically, which at the time I figured that could be due to the recommendation of mental health providers, et cetera, who were treating her.
Right. And who told you that?
Her sister.
Now, how long did you visit with her?
It was brief, maybe 30 to 45 minutes.
That's all I have. Wait a minute. Did you guys have a group get together in December of 2022, if you recall?
I don't recall.
Do you recall seeing her after Thanksgiving around that time frame in December of 22?
I don't recall no.
Do you recall having conversations with her around that time frame, which would be in December of 2022, that she was talking to you about medications and asking you questions about a particular medication?
I don't recall the exact time frame of those conversations.
Okay. You were summoned here today by the DA's office, is that correct?
Yes.
You were also on my witness list as well, right?
Yes.
And when I ask you about the conversations, the reason is you were questioned by the state police back in January of 23. Do you remember that?
Yes.
And one of the troopers had asked you whether or not you had any conversations with Lindsay, your friend, about medications, and you indicated that, and I quote, page 12, she knows that I'm pretty open about mental health, that I'm a big advocate of mental health, and she asked me if I knew, like you know, if I had tried a medication. Do you remember saying that?
Yes.
Okay. Does that refresh your memory at all as to approximately what time, when that was? Would that have been in December of 22, after Thanksgiving?
I don't know. I still don't recall the exact time, but I do remember that being a conversation that we had.
Okay. Do you remember where you had the conversation?
It was over text message.
Okay. Do you recall her asking you what your experience was? Because you had some knowledge of medications, correct?
As a patient.
Okay. And as a result of that and being close and good friends, that she had asked you what your experience was. And again, it's page 13. And she would say, how was your experience? Did you ever take this? What was your experience with this? That type of thing. Do you remember that? That conversation?
I don't recall the specific conversation.
Do you recall the medication that she asked you about?
Yes.
What was that?
I remember it being Lexapro.
Do you recall in your text message exchange that she had asked you about or told you about some of the medications that she was taking and that there were some difficulties with it?
Yes.
Do you remember that she had asked you whether or not you had noted or if you were aware of any side effects of medications?
I don't recall.
And after those text threads and with that understanding, being as close to Lindsay as you were, she then confided in you that she was having dark thoughts, as I think was the expression.
That was a long time after the conversation that we had had about the medication. I do remember that being the first time I had heard any concern around her mental health up until that point.
Okay, and what point was that, if you remember?
Can you restate the question?
Sure. Let me ask it this way. When she told you that she was having problems or difficulties with the medication and when she was telling you that she was having dark thoughts, do you remember when that was?
Towards the end of January 2023.
Okay. Do you remember, was that in person or was that a message, text message?
Over text message.
Did she explicate or did she explain what the dark thoughts were?
No.
And the next time you saw her after that was at the hospital rehab, correct?
Yes.
Thank you, ma'am. That's all I have.
Counsel? All right, thank you, ma'am. You may step down.
Commonwealth calls Christopher Clancy.
Oh, sorry. Before we hear the testimony of Christopher Clancy, this is important. I like this comment from you, Ava. Ava said that conundrum of actions from women has really been spotlighted in this case. Yes. That reminds me of the Tammy Wynette song. Sometimes it's hard to be a woman. Giving all your love to one man. It's hard to look. Motherhood, just it's all hard, and trying to put on a brave face when you're struggling internally because you have other people, specifically tiny humans, who rely on you for everything. Her children were so young. They relied on her for everything, and you try to muddle through it. But this last witness, and I don't know why maybe they just wanted to get her up there before the defense had an opportunity to, but she is telling her friend, and this I find interesting. She's telling her friend that she has dark thoughts. She's asked if Lindsay explained those dark thoughts. She says no. But then me being nosy, I would want to ask, did you ask her what those dark thoughts were? I'd want to know. I also thought that it was really good that she said that she did not discuss the events of January 24th, 2023, or the children in general with Lindsay on the advice of mental health providers. That's what she thought the advice came from. And I think that's important rather than rather than, she was told by by Lindsay's sister that she can't talk about her crime under the advice of the attorney. If it came from the mental health providers, then that is indicative of it's an issue and one they're working through and don't want exacerbated by a visit. So please avoid that topic. Yes, ADHD playlist. Even just being married, no kids is hard. I admire all mothers. And I agree with this too, Neat. I bet the friend regrets not asking. Absolutely. I'm sure there's a lot of regrets to go around. Winter Lover said, I would have absolutely asked her what kind of dark thoughts are you having. I probably would have too.
Is this my water? Okay.
Good afternoon, sir.
Good afternoon.
Hi, call off.
Thank you. Good afternoon. Can you please state and spell your name for the record?
Say that again, I'm sorry.
Could you please state and spell your name for the record?
Yes, Christopher William Clancy, CHRISTOPHER, WCLANCY.
And what's your date of birth?
7/26/61.
Where do you live?
Situate, Mass.
And do you work?
No, I'm retired.
What did you do before you retired?
I was a plumbing contractor.
Is Patrick Clancy your son?
Yes.
When did you first meet Lindsay Clancy?
I don't know what the year was, but I believe I met her for the first time at at the cottage in Hull. That was my parents' house, and I believe that's when I met her. I think he brought it down there.
Was that before or after she and Patrick had gotten engaged?
That was before.
And eventually they got engaged and got married, correct?
Correct.
And had 3 children, correct?
Correct.
So I want to direct your attention to the time frame after Callan was born in May of 2022. Did you have a chance to observe Lindsay interact with Callan?
Yes.
And what was Lindsay like with Callan?
She was very mothering.
And was she protective?
I would say yes, like any mother would be.
Do you recall describing her previously as very protective of him?
I would say that she was very protective of him.
Was she, in terms of how protective she was of Callan versus Dawson and Cora, was she more, less, or the same?
I would say she was more of the same when the babies were little, when the babies were young.
So was that something typical when she would have one of the children? She'd be very protective when they were first born?
Yes, I think that's like any other mother, though.
And how often would you see the family?
We saw them regularly. They lived not too far from us. They lived in Weymouth first, and we saw them regularly.
And then eventually they moved to Duxbury?
Yes.
And directing your attention to the time frame between November 16th, 2022 and Thanksgiving of that year, did you see them at your house?
I think they did come up to our house one time. Might have been a Saturday or a Sunday.
Okay. And why did they come over that day?
I think they just came over to say hi.
And what was Lindsay's demeanor that day?
Very good.
And was there any difference in her behavior or speech pattern than what you've seen with her previously?
Not that day.
And how was that visit?
Very good.
Did you then see them at or around Thanksgiving?
Yes, we did.
Okay. And where was that?
That was at my daughter Laura's house in
And-
Hamilton.
I'm sorry, I didn't mean
In
to.
Hamilton.
And did you interact with Lindsay that day?
Yes.
What was her demeanor that day?
She seemed a little, how do you say it? Let me think for a minute. She seemed quiet.
And did she seem to interact with everyone there as she normally would?
Yeah, she was very close with my daughters and her sister-in-law.
Do you recall them wearing coordinating shirts that day?
I think so.
And during dinner that day, did you make observations of Lindsay getting the kids settled down for dinner?
I did.
And did you see her interact with Dawson?
Yes, I did.
And can you describe that interaction, please?
Mm-hmm. She was getting a little frustrated. Dawson was being a little silly, and she was trying to get him to sit down. And she was just a little bit getting frustrated with him, and I noticed it, so I got up to help her.
And when you saw her getting frustrated with him, did you see her do something to get him seated?
She took him by the arm and to get him seated. It wasn't anything crazy.
Right.
You know.
It's not like she hit him or anything like that.
No.
Right? She just took his arm and guided him to the seat. Is that correct?
Correct.
But you could see that she was frustrated.
I
correct?
could.
And so you stepped in to help her, right?
Correct.
And what did you do to help?
I got her a plate, I believe. There were a lot of people, so it was just a little chaotic.
Now, directing your attention to the weekend before Christmas 2022, did you stop by their home that weekend?
I believe we did, yeah.
And who was there?
Her parents.
So it'd be Lindsay's parents, Lindsay, Patrick, and the kids?
Yes.
And were you by yourself or with your wife?
I was with my wife.
And was there a specific point for everyone stopping by and gathering that day?
I don't recall that.
Okay. Were you and your wife checking in or helping out that day?
We might have just been going down to check on things.
Okay. Did you know that there
Help out.
were some struggles going on at that point?
I did.
And did you know that Lindsay was, specifically Lindsay was having some struggles at that point?
Yes.
Did you stop by again a few nights before Christmas?
I thought that's the night you were talking about. Yes, I guess we did.
Okay. And when you stopped by the night before Christmas, do you recall who was there that day?
I think the same people, but I'm not positive.
So Lindsay's parents, Lindsay, Patrick, and the kids?
Yes.
The night before Christmas. You mean Christmas Eve? I don't know why, but she just freaking really grinds my gears.
And what was Lindsay's demeanor that day?
It was okay. It wasn't terrible.
Do you recall testifying previously and saying that she seemed like she was in good spirits?
Yes.
Would that be accurate?
Yes.
And when you were there at the house that day, did you make plans for the following day for Christmas Day?
Yes, we made plans to go to Mass.
And who was going to go to Mass?
Lindsay, Patrick, the kids, my wife Sue, and me.
And did you all, we'll strike that, the following day on Christmas, did you go over to Lindsay's home before going to Mass?
Yes.
Okay. Did you all gather for breakfast?
I don't recall.
And let me approach. Page 33. If you can just read to yourself lines 2 through 7, and then just look up when you're done.
Okay.
Take your time.
All right. Okay.
Does that refresh your memory, sir?
Yes.
So did you go over that day for breakfast?
Yes.
And how was Lindsay's demeanor that day?
It was good. She looked beautiful. She had a beautiful dress on.
And do you recall saying previously she seemed very happy that day?
Yes, she did.
And after breakfast, did everyone go to church as planned?
Yes.
And how were the children in church?
Fantastic.
Very well behaved.
Very well.
And then after church, did you have a conversation with Lindsay outside of the church?
I think we talked a little bit. I don't remember what we said, but we were going our separate ways.
Do you recall saying previously that Lindsay said she was glad she came and she really loved it?
Yes.
What was her demeanor while she was engaging with you after Mass?
She was quiet. She said that she liked the Mass and she was really happy that she went.
And do you recall saying before that
I would just like the record to reflect that there is nothing like midnight Mass on Christmas Eve. It is more. I've been to many of them. I was raised Catholic, and I think of all the Masses, including like Easter, I think, because those are the two big ones, Christmas Eve and Easter Mass. I think that Christmas Eve Mass, midnight Mass, is the most beautiful Mass that the Catholic Church does.
that? Do you recall after that conversation, you guys hugged each other and went your separate ways?
Yes.
Did you see the family again after Christmas?
I'm not sure. I'm not sure.
Did you go to Cora's birthday party?
No.
Was it more of a kids gathering at a trampoline place?
That's what I heard.
Okay.
Yeah.
All right. Did you have plans to see them Tuesday, January 24th, 2023?
No.
Do you recall saying previously that there were plans to get together for dinner that night, but they changed because your wife had plans with her brother?
No, we never had plans to go there Tuesday night. They asked us to come to the Tuesday night, but we already had plans with Sue's sister Joan.
Okay, so there weren't set plans, but you were asked to come to their house that night.
Yeah.
Okay. And then you couldn't go because you had other plans.
Right, we were going to make it for Friday.
Thank you for clarifying that. In terms of your interaction with Lindsay and Patrick and the kids, while there were some struggles going on, did you and your wife offer to take the kids to your house overnight to kind of give them a break?
I did mention that to my son.
Okay. And was that offer declined?
Yes.
And going back to Thanksgiving of 2022, when you were interacting with Lindsay, I think you previously said that her demeanor was good, she was quiet. Did you also say at one point she had a little blankness to her at times?
She seemed to at times.
And can you tell us like what that was?
Just like a stare.
Kind of staring off into the distance, distracted?
No, just not totally interacting, just sort of.
Okay. So at some points.
Almost like nervous, kind of like.
Nerves?
Almost just like, something like that.
Okay, so at some points she was staring a little bit, seemed a little nervous, but then in other times she was interacting with everyone as she normally would?
Pretty much.
Okay. You mentioned earlier when you were talking about Lindsay having a little bit of difficulty getting Dawson seated at Thanksgiving that he was being a little silly.
Yeah.
Was that typical for him to behave in that way?
Yeah, he was a handful, but he was good. He was a good boy.
Going back to the night of January 24th, 2023, at some point in time that night, did you get a phone call from Patrick?
In January?
January 24th, 2023.
Yes.
Go ahead.
Yes, we did.
And what was his demeanor during that call?
Is this the night of the?
Yes.
Okay.
Yes.
It was terrible.
And did you and your wife leave your home and head to the hospital to be with him?
Yes.
Thank you.
Attorney Reddington.
Thank you. Good afternoon.
Good afternoon.
Mr. Clancy, just a couple of questions. You were summoned to be here by the DA, is that correct?
Correct.
And you gave statements to whoever wanted statements. You were very cooperative with the investigation, is that right?
Yes.
And being as you're the, obviously, grandfather and father of Pat, over the years, from the time they were dating, engaged, married, kids, you and your wife were pretty close with both of them, were you not?
Yes.
Do you have an opinion as to how Lindsay was as a mother that you could see?
She was very, very good. She fed them great. She did a lot of things with them. They did like the all-American family.
And district attorney had asked you about Thanksgiving of 22, November 16th of 22, and she made reference, I think you had responded that she appeared to be quiet, and then she used the term, did you know about the struggles? Can you tell me what the struggles were? Do you know what she meant by that?
I knew.
Go to sidebar.
Sure, yeah.
Why are we going to sidebar? What is the problem? You opened the door to this. You asked the man if he knew about the struggles. The defense attorney has every right in the world to ask what the struggles were. If your objection is to hearsay, he can still answer that question without testifying to what anybody said. Maybe not, though. Might be a little hearsay. I don't know. She's just annoying me. I will say this. Okay. We talked about this yesterday, the bows. I am of the opinion based on, I think Becky in the chat had said that she was wondering if they were wearing the bows because Cora loved hair bows. And perhaps they were wearing, she was the district attorney, Buckingham was wearing the bows to honor her memory. So I'm not going to comment anymore on the bows, because if that's the situation, then that I would feel bad. So I guess maybe this might be a little hearsay. I don't know. Because I mean, unless if he heard, it depends on who he heard the struggles from, right? It's possible that he heard about the struggles from Patrick, but he might have heard about the struggles from Lindsay as well. In which case, because she's a party opponent, aka the defendant, it's not hearsay. But if it came from Patrick, it might be. I know that's how I felt yesterday, crazy mama. I felt like a jerk. So yeah. I don't know. I don't want to skip too much because we're getting close to them, because we're like an hour behind. And we're getting close to them going to lunch. And I just want to make sure that we can skip. Geez, Lou, they're on sidebar first. They're still on sidebar. Oh, wait, I lied. Yeah, then I think they're going to take lunch after this. Yeah. All right. So I'm not going to skip because I don't want to, interesting. Happy, welcome back, babe, says, I've learned that the Massachusetts DA is up for re-election this year, and thus why this case wasn't given a plea deal. People wanting fame. That's really sad. That's really sad. I mean, I know that the district attorney position is they're an elected official. That's true. And getting reelected is important. It's a priority. But I think the bigger and more important priority is justice. And I believe that there's a way that this case could offer justice that wouldn't be dragging 18 people through hell to listen to. Look, of all the things that the jury is going to hear thus far and see, it's going to be that autopsy picture. That's going to stick. Those autopsy pictures of Callan are going to stick. By the way, I forgot to catch you up, Maria. I hope you're still in here. Maria, there was testimony from the medical examiner, okay? And the only child's autopsy that was discussed was Callan's. And it's my personal opinion that was done intentionally, obviously, for the purposes of eliciting an emotional reaction via going into deliberations for the jury. The reason why I say that is because Callan passed away at the hospital. Okay. So when that happens, they bring the person to the medical examiner as is. All of it, everything that was on the child in this case at the time when all the medical therapies were provided to him, trying to save his life, resuscitate him really, those are kept with and on the body. So when the medical examiner's office photographs Callan, he's intubated, he's got a catheter, he's got several lines that IVs that they started, all the things. It's very, very shocking to see that. It would be shocking to see that on an adult, much less an 8-month-old baby. And I understand that for the purposes of the trial, one of the things that is required by the state is to prove that the human beings that she is charged with murdering are in fact dead, and that they died in the manner of homicide. Okay, the manner of death is homicide, which we all know there's a different term that means something different in medical examiner terms than it does. It's not a legal conclusion. So that just means at the hands of another. And that is part of the I dotting and T crossing things that have to happen during a trial. However, if that was the case, that being the case, to use the most the child that would even elicit a visceral reaction, even if it's not outward, just inside your head, right? To use that child's autopsy photos when you don't actually have to. It's not necessary. She's not saying she didn't kill the kids. Not thinking of the impact that's going to have on those jurors later. It's just shitty. So, Happy says, does anyone know if she's tried to unalive herself while in the institution? I haven't vetted this info yet. I can look into it and see if there's anything. Jeanette says, I feel this case is another excuse of how this country ignores the severity of mental illness and want to create an excuse instead. We are still screaming witch with our pitchforks. It's so irresponsible. I will say this. I've sat and listened to a lot of trials in my day. trials that I've watched and not even covered before YouTube was even a thing. When you used to have to watch it on Court TV on cable, and I'm open to hearing everything, but the more the Commonwealth they're the ones that are pushing me more and more towards this. What this is like a production, the way that the defense attorney Reddington stated in his opening statements. I didn't understand in the very beginning when this case happened and then they charged her with first-degree murder. I didn't understand why they did that, and I thought, well, there must be some, big, huge bombshell evidence that they're going to present at trial that's going to, answer, that's going to just tie this up, right? That's such a terrible turn of phrase. I shouldn't have used that. I'm sorry, you guys. That's going to explain this and why it's not a mental health issue with her being in a state of psychosis. But yet we're on day 8 and we're not even there yet. So I thought certainly we're going to hear something. We're going to hear something that is going to move us to understanding the first-degree murder charge. We're on day 8 and nothing. I'm nowhere close to that.
Thank you, sir. I think I was asking you about the word, the struggles, and can you just tell the jury what was meant by the struggles?
I knew she was having a hard time sleeping. I knew she just didn't feel well. I know she had gone to the emergency room where my wife was working. Those types of struggles.
And just so, obviously for the record, your wife would be Sue?
Yes.
And she's a nurse, labor and delivery at South Shore?
Yes.
And did Lindsay confide, to your knowledge, yes or no, to your wife about some of her issues as a result of which your wife referred her to a person to speak to?
Yes.
Do you know who that person was?
I don't remember the person's name.
Okay, would that be the South Shore perinatal, I think is what it's called?
Yes.
Okay. And understanding that you're the father-in-law, would you agree that the two of you and Lindsay, had a pretty good relationship?
Yes, very good.
And you told us about November 16th and then Thanksgiving of 22 and then up until Christmas and then after Christmas, and the time frame actually right up to January 24th, you guys were supposed to get together that night, right?
Correct. Well, no, we weren't. We were asked to come to dinner that night.
But you had other plans?
We had other plans.
Okay.
Okay. Now, here's what I need to know. Okay. I need to know, when were they invited to dinner that night? Were they invited to dinner on the 24th? On the 24th? Or were they invited to dinner on the 24th, like say a couple of days prior or something? Because I think I would want to know that. I just want to know.
District Attorney asked you about, on a number of occasions, about the time at your home. I think it was on Thanksgiving when Dawson was acting a little rambunctious or silly, and that she guided him to his seat. Was she, to your opinion and what you could observe, did you believe that she was being abusive to him at all?
No.
And you know her mother and father as well, correct?
Yeah.
And the four of you, the in-laws from both sides, you and your wife, Sue, and Lindsay's mother and father, both were all kind of pulling together to try to help this young couple out during that time frame, right?
Yes.
And your son, Patrick, he was very concerned about his wife, was he not?
He was.
And he confided in you on a number of occasions.
Yes.
I'm sorry, sir. Thank you.
Como?
Nothing further.
All right, thank you, sir. Let me sit down. Thank you. Como, could I see you over here just scheduling?
Oh, for the love of Pete. They were just up at sidebar. You couldn't have wrapped that up at the same time? Come on, Judge. Just let the jury go to lunch. We know you're going to take lunch. Let them take lunch. The mother-in-law is on the list, Neat. This is where I'm at with all of it. This is so succinct, and this is why I adore you, Neat, because you put things so well. Neat said, I am willing to believe that Lindsay Clancy was an evil, cold-blooded killer who didn't want her children anymore. But they need to show me that. Exactly. At this point, there's been no evidence that would help us, or the jury for that matter, answer the legal question to which they are charged with answering. Yeah, he's done that a lot. Jenny says sorry, sir, will go a long way with the jurors. He also apologized to the first responders as well and thanked them for their service. And her friend of 29 years, he said, are you nervous? And she said, yes. And he said, well, don't be. Trying to reassure her. That will go far with jurors. Jurors pay attention to that. We pay attention to that. And after all, are we not unless you don't live in the United States, aren't we all potential jurors? Shmita, is there a jury system in the Canadas? She is on the list. Shmita says, I hope so. I'd like to hear about the claims of Lindsay telling her she was hearing voices. I would too. Jeanette says, when this first happened and bits and pieces were coming out, my first question was, why didn't anyone try harder when she was begging for help? 3 years later, and I'm still waiting for that answer. Well, oh, good. Okay, Shmita says, yeah. First, before that, Karen says 62 viewers and 50 likes. Do the channel a favor. Give her a thumbs up. Thank you, Karen. I appreciate that. Shmita said, LOL. Yes, ma'am, we have juries. Catherine says we don't have a jury system. Wait a minute. Catherine, are you Canadian? You from the Canadas? You know, I say that because that's how Mike the Situation from Jersey Shore said it when he was really too turned one night, and there were girls visiting the house in Miami, and they had been at the bar, and he was like, they're Canadians. They're from the Canadia. And it was just funny to me, and I never forgot that. Oh, you're in South Africa. Okay, so South Africa does not have jury systems. Okay. So, yeah. I'm sorry, my bad. Yes, Karen is the best hype girl. She really is. Thank you, Karen. You know, they say that, and I don't know who they is, just people, I suppose. But why can't I think of his name? I can see him right now in my in my mind's eye. Flavor Flav. They call Flavor Flav the best hype man in the business. And that may be so. But Karen is the best hype woman in all the tubes. And I appreciate it. Thank you. I do too, Neat. Neat said, I love that someone from South Africa found us here. Me too. We have I think it's cool that we have like people from all over different countries, different walks of life, everything. I think that makes for the best discussions. I love diversity. Teacup Kraken said, my brother is trying to get a Canadian dual citizenship. I hear that the Canadians don't be handing out citizenship. It's very difficult to become a citizen of the Canadas. And I would absolutely say that if I were applying for a Canadian citizenship, I absolutely would not pronounce it like that. I would say Canada. I would like to have a Canadian citizenship. Can you imagine? I think it would be cool. I would be bugging Shmita though. If I had Canadian citizenship, I'd be bugging Shmita all the days. I'd be coming over like this. Shmita. That would be me. All the days. Oh, well, seems like the Canadas is a little snobby. Shmita says, if you have even the smallest criminal record, you're not even allowed in, let alone a citizenship. Well, sheesh. Okay. So the court is on their lunch break until 2 p.m. Eastern, which really means 2:15 Eastern. So how are we feeling? Let's do a poll. I haven't done a poll in a while. So let me go over to the channel here and put up a poll. It's on day 8, all this testimony. Let me see how y'all are feeling about all of this. Tell you how I'm feeling. I'm feeling like I need a nap. Let me mute myself. Nobody wants to hear me twice, especially me. All right. Start a poll. We're going to start a poll, y'all. Here we go. Okay. Wow, Jen, you're really just not typing good today. All right, there's the poll. This will be our lunchtime poll. All right. This is our lunchtime poll. Should Lindsay Clancy be found not criminally responsible or, hold on, let me see. I can't even see the poll. Let me look at my phone. Lord Jesus. Or guilty of first-degree murder. I think that's what I wrote. Yes. Should she be found not criminally responsible or guilty of first-degree murder? And we'll look at that in a sec. We'll do a lunchtime poll like Heathers. Y'all ever seen that? Who in here has seen the movie Heathers? Oh, I wanted to tell you guys something. I told you guys I've been watching Welcome to Springvale, right? No, Shining Vale. Very good show. Only 2 seasons. Started out on Stars. It didn't get picked up for a 3rd season. It's really good though. And so it's only got 2 seasons, but it's on HBO Max. Very good. 10 out of 10 would recommend. I've also been watching Widow's Bay. Just finished the 1st season. 2nd season's scheduled to start in September. I am interested in watching. Ryan Murphy's got a new series called The Shards. Takes place in the 80s high school. Looks promising. I'll let you know. What else? Oh, I also on Apple TV. Widow's Bay is on Apple TV. Also on Apple TV is Cape Fear. Rather than redo the movie, obviously remake the movie, I don't think they could. They have made it into a series, and what is his name? Jeffrey Dean Morgan plays the antagonist. I'm quite interested in seeing that. Oh, wow. Thank you, Karen. That's really sweet. Karen said, the channel lives up to its name with full honor in every deep dive release. Thank you so much for that. Thank you. I appreciate that. Thank you. Listen, I owe you guys a Patreon, and I owe you a 3rd episode from West Memphis 3. That is a passion project for me, and I just really wanted to cover this trial, and but the West Memphis 3 is definitely a passion project, and there's been no update that I'm aware of yet. Let's look. Let's Google out while we have a chance. Oop. Let's try this. No. No update yet. There you have it. Was it Javier Bardem that was in Cape Fear? Did I get that wrong? What? I think you're right. Hold on. Let me Google out to make sure we're talking about the same thing. Also, yesterday, after we got off the live, oh, it is. You're right, Javier. I love him too. Jeanette says, Jen, you don't have to answer, but I have to ask because it's been bugging me. Is Dr. B still around? She doesn't go on her channel anymore. Dr. B is still around. In fact, she's come in the chat a few times. And I text her. She's really busy. It's hard to get a hold of her. But no, she hasn't put anything on her channel anymore. I miss her. And I miss our lives together. I really do. I mean, I miss her in my life as a friend, the way because we used to we talked all the time. But she's busy, and I'm happy for her, and everything's going good for her. And so I know she'd be thinking about me like I think about her. But yeah, she's just busy. I miss her a lot. I do. Aw, crazy mama, that's so nice of you. Crazy mama said, Karen, I second that. I refuse to watch other channels that call themselves true crime when they are crumma. I love Jen Lou. Well, I love you too. Thank you, crazy mama. I know, Shamita, I miss her too. Maybe we can all harness our chi, and call her. And maybe she'll maybe she'll pop up. I know she watches my stuff, because she'll pop in every once in a while in the chat and let me know, especially when I'm covering trials and talk. But she's really busy, and I miss her a lot. I do. Oh, thank you, Jeanette. Jeanette said, thank you for sharing. I loved you two together. Always a blast. Whenever I first started the channel and we would alternate going on mine and going on hers and doing true crime roasts, I remember getting a comment on my channel that was like, this is like listening to two people on the phone who have inside jokes. You got to start sharing with the class. Oh, I miss Dr. B. We had so many laughs. When she came to visit me, God, it's been a long time now. What, in 2022, I think, is when she came to see me. And she stayed for a week. Y'all, we had the absolute best time together. And we did not even, it's not like we were doing things, right? Like we weren't doing all the touristy things, we just hung out at my house and just chilled. And it was the best, and ate. All we did was eat snacks. You know what I mean? Like we didn't have like any special like plans, or activities to do. We really just hung out at the house and chilled, and it was the best time ever. It really was. It really was. Oh, those group calls. The ward girls on the group calls. Yes, because it would be me, Dr. B, Shmita, Sam, Deja, Mo. Oh, we had the best time, us girls. We just had the best time. Yes, we did go to the Publix. We did go to the Publix. Because she was very anti-Publix after Grant Amato, and I had to get her over the whole situation with Grant Amato and her mistrust of Publix, because she needed to understand the deliciousness that is a Publix fruit bowl. And I told her, I said, I swear, if you come in with me, you will not have any regrets. And I am here to report no regrets. Them Publix fruit bowls are just, they're the work of angels. They really are. They're just the best. Yay, Sarah has hot water again. Woohoo! Oh, you guys want to hear something messed up? I'm going to tell you anyway. Okay, so how I was like bitching about the situation with my AC, right? Okay. Well, do you know what? After we sent in a work order well before the temperature outside in Texas was several consecutive days of over 100 degrees. Okay. We would never, between my husband, we understand how an AC works in this house, and I'm just going to leave it there. Okay. And, we would never submit a work order in that time frame, because we are fully aware of the limitations of an AC unit when it's above 100 degrees and it's humid. Okay. We understand that. That being said, after we submitted that work order, now there was another part to that work order. It wasn't just the AC. I guess I think I told you guys this, how my husband was pulling down on the, it's one of those pole lights from 1982, 1962, really, 32. Anyway, in the closet, and he pulled it, and the whole cord came out, or the pull string, or whatever you call that thing. Anyway, it came out, so we needed that fixed, because you can't turn on the closet light without it. All right. So that was included in that work order. So then they send out this community, whole apartment complex wide notice about what to expect from Texas heat. Like, get bent. First of all, let me just explain something, okay? we understand Texas heat. We understand humidity. We moved here from the motherfucking Floridas. Now, that being said, is where we lived in Florida as humid as it is in Texas? It's actually more humid there. Okay. But you acclimate to it and you don't feel it. It's when you leave and come back, that's when you notice it. Okay. But it is more humid in the area of Florida, and certainly farther south in Florida you go towards Miami, central, all the way, you know, Florida's fucking muggy. There's a whole swampland there. Okay. So that pissed me off. Number one, which I know it wasn't like the email was a community wide. It wasn't like personally directed at me, but I don't give a rat's fat kneecap. It pissed me off. It felt personal. Like rationally, I know it wasn't, but it felt personal. So then I'm thinking to myself, okay, so there is a law in Texas that the AC doesn't have to work well. It only has to work. So if the ambient temperature, and that's what it feels like outside, not the temperature humidity index. No, yes, that's wrong. If it's over 100 degrees, the best you can hope for inside of your home is 20 degrees below that. So that would make it 80 degrees. Thing is, it isn't just the AC that doesn't work. It is the H in the HVAC as well. This winter, we had at the beginning of the winter, it was rather mild. But then we had a cold snap, and it iced and it snowed, and it was, you know, very, very cold here for several days. For, you know, not Canada cold, okay, not Antarctica cold, not penguin weather. I mean, it was penguin weather, but not for like a long time, okay? So that happened. The thing about being cold is it's bearable when you're indoors because you can always add more layers of clothes, right? When it's hot, once you're sans clothing, what else is there to do? Like once you've reached 0 levels or layers of clothing, then what? You can't, what else can you remove? Just, and when you, and so the first time they came over to look at the AC, I explained to the guy what was going on. And he was like, well, you know, you're never going to get it. You're never going to remove the humidity out of here. You know, heat rises, which that also irritated me. I am almost 50 fucking years old. Okay. If I don't understand the fact that heat rises, we have a whole other separate issue going on here that needs addressing. And you're not the person to do it. It's bigger than the H, the V, the A, and the C. Okay. So then I said to him, so he explains that to me. And I said, oh, okay. So heat rises then, right? Is that right, Mr. Science? Well, then let me ask you this. If that be the case, which it is the case, science is just science, then how come it's fucking cold in here in the wintertime if heat rises? She's heating her apartment downstairs. Shouldn't her heating her apartment downstairs cause the heat from downstairs to rise up? Or does that only apply in the summertime? Does heat do something different in the wintertime? See, don't give me the flim flam, and don't talk to me like I'm an idiot. The first year we lived here, and I use the term, they're not HVAC guys. I know they're not, because they use terms like, oh, just wait, it gets better. So anyway, the first year we were here, we had this issue and I explained it. Do you know what that maintenance man told me? Oh, well, you know what it probably is? There's probably like an air bubble behind the thermostat. What did you just said? Is that what you're really trying to tell me? I mean, I don't need to be treated like I'm Einstein level genius. Okay. I don't expect that because I don't even think I am. All right. But please don't come over here and pee on my leg and tell me that it's raining. Don't insult me like that. That's so I can't stand that shit. You're really going to sit here with a straight face, look me dead in both my eyes, and tell me that the reason the AC is not working and not cooling is because there's a motherfucking air bubble behind that thermostat? No, Shacto, we do not have basements here. Texas, like the Alamo, has no basements. If you know, you know. You get that? I'm very curious if you guys get that movie reference. It's an old one. That's what they tried to tell me. There's an air bubble. Okay, I'm done at this point. Like I don't. So that very good, Shecto. Very good. When he goes to visit the psychic, she says, "It's at the Alamo in the basement." And then when he gets to Texas and he visits the Alamo, he says, "Where's the basement?" And the lady says, "The Alamo doesn't have a basement." It's the best. There's no air bubble. It's ridiculous. It's the most cockamamie ass bullshit I've ever heard in my life. So then I'm sitting here, and I've been wondering this for the last week and a half when they cleared my work order, removed my work order. Okay, so it's hotter than balls outside, and you're just absolutely not even going to fix my AC. Fine. But what is keeping you from fixing my light? Why can't you fix that? Am I not allowed? It's not a requirement that I be able to see in the closet. We won't be. We will not be re-signing our lease. Tell them Large Marge sent ya. Hey, Lil Red. Thanks, babe. Yeah. It's probably the air bubble. The air bubble. But watch. Mark my words. When we move out, they're gonna yes, we have to pay for water. Watch and see what I tell you. They're going to try to charge me for this. Do you know that not only do I have that email where the work order was requested and removed from the system by whoever's in charge of removing things from the system, not only do I have that email saved, but I have screenshots of the work order itself that went into the system as it happened. Don't play with me. I'm about receipts. I just don't like being treated like I'm stupid. That's what I don't like. You know what I mean? Like explaining to me like you're like we're on the show fucking Mr. Wizard and you're trying to explain to me the science behind heat. Even after I tell you that our electric bill for this apartment is higher than our electric bill ever was in Florida for an entire house. And P.S., the electric provider in Florida, in my part of Florida, is Duke. I'll leave it there. And Duke is expensive. It's ridiculous. This is just the most cockamamie level of bullshit I've ever experienced in all my life. And it's not like I've never lived in Texas before. It's not like I've never lived. It's been a long time since I've lived in an apartment in Texas before. But I have other questions and concerns. So last year I was very excited for winter to be here because, well, Shacto, you know what irritates me about this is what irritates me about that. The apartment complex knows what my husband does for a living because it's on our application to rent here. You have to provide your employer's name. And he drives a work van. which is also registered with the apartment complex so they understand. So why are you giving me the bullshit? I don't like it. So yeah, this is the only place that I've ever lived in my entire 50 years on this planet where the fucking fireplace doesn't work. And by that I mean, can you actually light a fire in the fireplace? Yes, you can. It is a wood burning fireplace. Do you feel the heat from that wood burning fireplace? No, you don't. I've never seen such. Ever. Ever. Lisa, are you in the Floridas, babe? Or are you somewhere where Duke is your electric provider? Because Duke ain't cheap. And the thing about Florida electricity is, where I was anyway, I think the whole state's like this, but they're not deregulated. So they're still
Your Honor, for the purpose of the record,
whatever they want.
for the purpose of the record, we return back to the record in the matter Commonwealth.
Okay, so I would like to thank you all for being at my TED Talk and listening to me vent and letting me get that shit off my chest, because it's really been pissing me off for the longest time. And I needed to vent about it. I needed to vent. I'm not happy when I'm hot. There is no reason why it should be 78 degrees in this apartment. It's not like we're being unrealistic. Okay. We don't have our thermostat set to 65, 69. Hell, we ain't even got it set to 70. We keep it at 73. Bunch of bullshit. All right, here we go. Thank you for coming to the TED Talk. I'm going to end the poll. Let's see where we're at. So, ending our lunchtime poll. 6%, there are 33 people who voted. 94% say Lindsay Clancy should be found not criminally responsible. And 6% say guilty of first-degree murder. So thank you for participating in the lunchtime poll. Court is back in session. Thank you for listening to my vent sesh. Let's go.
Versus Lindsay Clancy. All parties are present, including Ms. Clancy, excluding the jury.
All right. Counsel, we ready for the jury?
Yes, Your Honor.
Yes, Your Honor.
Okay, sure.
Court, all rise. Jurors enter. This court's now in session. Please be seated.
Good afternoon, Your Honor. For the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including 18 jurors.
Madam Clerk, thank you. Members of the jury, good afternoon. We're going to return to the case. Attorney Sprague.
Thank you, Your Honor. Commonwealth calls Kyle Carney.
Good afternoon, sir. Stop right here with the right hand to the clerk, please.
Good afternoon. Do you solemnly swear that the testimony and the evidence you shall give to the court and the jury in the matter now pending between the Commonwealth and the defendant partially the truth and the truth and the truth so help you God? Thank you, sir. You may have a seat.
Watch your step, please.
Excuse me, can we proceed?
Sure. All right, good afternoon, sir.
if I may.
Yes, Counsel, go ahead.
Thank you. Good afternoon. Can you please state and spell your name for the record?
Yeah, Kyle Carney, Kyle-E-C-A-R-N-E-Y,
And your date of birth, please.
July 6, 1991.
And what town do you live in?
Duxbury.
What do you do for work?
I work in finance.
And are you married?
Yes.
Who's your wife?
Sarah Carney.
And you have children?
Yes.
Does your family, or did your family know the Clancy family?
Yes.
And did you know them through your friendship with Patrick Clancy?
Yes.
When did you meet Patrick Clancy?
2009.
And how did you meet?
We went to college together.
And after going through college together, did you remain friends after school?
Yes.
And eventually, did you end up living in Duxbury at the same time Patrick and his family lived in Duxbury?
Yes.
When did you meet Lindsay Clancy?
Maybe 12 years ago.
Did you meet them before they were married? Did you meet Lindsay before she married Patrick?
Yes.
Okay. And then obviously you knew them after they got married and as they had their children.
Yes.
How often would you see Patrick and his family while you were both living in Duxbury?
Maybe every other month.
And would you interact with Lindsay Clancy during those gatherings?
Yes.
And what was her typical demeanor?
Kind, caring.
Did you ever see any changes, significant changes in her behavior or demeanor when you would interact with her?
No.
Did you notice any changes in Lindsay Clancy after the birth of Cora or Dawson?
No.
Directing your attention to after Callan Clancy was born, did you interact with the Clancy family that summer?
Yes.
And how so?
Maybe beach dinners. It's hard to recall exactly.
So you said beach dinners, is that what you said?
Yes.
So basically families gathering together at the beach, having dinner, interacting with each other, is that right?
Sure.
How often would you do that during the summer of 2022?
I couldn't tell you exactly.
More than once?
Yeah, like at least monthly.
Okay. Did you also go fishing with Patrick during that time?
Yes.
Over the summer of 2022, did you notice any differences in in Lindsay Clancy's demeanor or behavior?
No.
Throughout the fall of 2022 into the beginning of January 2023, would you see Patrick Clancy?
Yes.
How often did you see him?
Again, maybe once a month, maybe.
And directing your attention to Sunday, January 22nd, 2023, did you have a small gathering at your home?
Yes, their family came over to my house.
Okay. And when you say their family, are you talking about Patrick Clancy and Lindsay Clancy?
And Cora and Dawson, too.
Callan didn't join them?
No.
Was he home with Lindsay's parents?
Yes.
And what was the purpose of gathering that day?
To socialize. It was a nice day out. I was having a fire to burn some brush in my backyard, and thought it'd be nice to invite them to come over and get the kids out and enjoy a nice day.
And what was Lindsay's demeanor that day?
I'd say quieter than normal.
And do you recall saying previously that the weekend was fairly normal, that Lindsay had always been a little tough to get a beat on, kind of quiet, but you were in the kitchen talking and it seemed normal?
I mean, in the kitchen, we had a conversation, and that was normal.
Normal, okay. Do you recall describing the day previously as a perfectly normal afternoon, really nice?
It was a nice day, yeah.
Okay. And so there was nothing out of the normal that happened that day in terms of Lindsay's behavior or demeanor?
her behavior, demeanor appeared normal.
Okay. Did you have any problems communicating with her when you had conversation in the kitchen?
No.
How long was the family there at your house that day?
Maybe a few hours.
And during that time, I believe you described it previously as a normal, great day. Would that be accurate?
Yes.
Okay. Thank you.
Mr. Reddington?
I have no questions. Thank you, sir.
All right. Thank you, sir. You may step down. Thank you.
Thanks.
Watch your step, please.
Your Honor, the Commonwealth will call Andrew Kiakio as its next witness.
All right.
Good afternoon, sir. Start right there, raise your right hand for the clerk, please.
Good afternoon. Do you solemnly swear that the testimony and the evidence you shall give to the court and the jury, no matter what kind of between the Commonwealth and the defendant, shall be true and the truth? Thank you, sir. You may have a seat.
All right, good afternoon, sir.
Good afternoon, Your Honor.
Yeah, counsel.
Thank you. Good afternoon, sir. Can you tell the jurors your first and last name?
Andrew Kiakio,
Can you please spell your last name for the record?
Chiachio.
And what do you do for work?
I work for the state police
And how long have you been with the state police?
since December of 2013.
And what's your current assignment?
I work for the Plymouth County State Police Detective Unit.
How long have you been with the State Police Detective Unit?
5 years.
And what's your current rank?
Sergeant.
I'm going to draw your attention back to January 24th of the year 2023. Were you still working for the State Police Detective Unit with the District Attorney's Office then?
Yes.
And do you recall being called into an investigation in regards to an incident that happened in the town of Duxbury on January 24th, 2023?
Yes.
Were you assigned as the case officer for that investigation at that time?
No.
But you're aware that a number of the other troopers in your unit were all called out to do different parts of the investigation.
Yes.
Do you recall if you actually went first to 47 Summer Street?
Yes, I did.
Were you quickly assigned to go someplace else and do some follow-up investigation?
Yes.
And one of the places that you went on that night was the CVS in Kingston, correct?
Correct.
That would have been at 189 Summer Street?
Yes.
Why were you asked to go to the CVS in Kingston?
To obtain surveillance video.
And had you learned information that one of the homeowners, the Patrick Clancy, might have visited that location earlier in the evening?
Yes.
And so when you got to the CVS, did you contact somebody in the store in order to try to determine whether there was surveillance?
Yes.
And did you speak with an employee there?
I did.
Do you recall who you spoke to?
Angela Kraus, she was the manager.
Were you able to get access to the surveillance at that time?
Yes.
And were you able to observe the time on the surveillance at the store as it pertains to real time?
Yes.
So tell us how you determined whether the time was accurate.
We look at the live feed and I compare it with my cell phone.
And your cell phone is a department issued cell phone?
Yes.
Did you notice any discrepancies in the timestamps?
I did not.
And after viewing the video surveillance there at CVS, were you able to see Patrick Clancy in the store at CVS?
Yes.
And fair to say you were able to track that he arrived at 17:32:32 and exited the store at 17:37:08.
Yes.
At some point, were you also asked to look for surveillance at a different location?
I was.
What was the second location?
The 3V restaurant
And where is that located?
in Plymouth.
Becky asked if Lindsay Clancy has been receiving visitors while she's been in custody. Yes, she can. She has. And one of them has already testified. Her friend of 29 years, which would be, I think, 3 witnesses. She was the witness before, no, yeah, I think she's the witness before Patrick Clancy's father, Christopher, testified. She visited her. Yes, Shannon, this is live and not behind. Right now, we're caught up. Well, we might be behind just a tiny bit, but not much.
And fair to say it's the address there's 10 Cordage Park Circle?
Yes.
What is 3V?
A restaurant.
Okay, and why did you go there?
To obtain surveillance video.
Again, based on information that you had available to you, did you believe that Patrick Clancy had visited that location earlier in the evening of January 24th?
Yes.
And when you went to the 3V restaurant, did you speak with 2 employees there?
Yes.
Were you able to access the video surveillance?
I was.
And while at the restaurant, were you able to confirm Patrick Clancy on their video surveillance?
Yes.
Now, as far as their video surveillance timestamps, were you able to observe the timestamps at that location?
I was.
And did you notice any discrepancies about the time?
No.
And what did you do to confirm the time?
I compared the live feed with my cell phone.
Fair to say you were able to determine that the video surveillance did confirm Patrick Clancy arriving at 17:54:14, that he paid for a bag of food and he left the store by the front door at 17:55:01.
Yes.
Now, in addition to gathering the video surveillance, well, let me back up for a second. So on one particular occasion, you were able to go and view the video surveillance, correct?
Yes.
At some later date, were you provided with copies of the video surveillance from both the CVS in Kingston and the 3V restaurant in Plymouth?
Yes.
And you brought that back to the state police?
Yes, to the
the
district attorney's
video.
office. Yes.
Okay. Now, as follow-up for this investigation, did you learn information about the route of travel Patrick Clancy took that night to go from his home to these locations?
Yes.
Did you do anything to try to ascertain approximately how much time it would have taken him to go to these locations from his home at 47 Summer Street?
Yes, I mapped it on the Maps application on my iPhone.
Now, do you recall when you did that?
I don't.
When you did this mapping of the locations, did it give you approximate distances and times between the locations?
Yes.
And fair to say, not knowing exactly when it occurred doesn't account for the time Patrick would have been there or any traffic or accidents or anything like that.
Correct.
Right? But as far as you could tell, you were just looking for approximate time frames.
Yes, a general idea.
Now, as part of this investigation, you also were involved in some interviews with potential witnesses.
Yes.
Is that fair to say? Including Paula Musgrove.
Yes.
And who's Paula Musgrove?
The defendant's mother.
And you also spoke to a former nanny of the Clancys named Elaine Flaherty.
Yes.
As well as the employees from CVS, Angela Krause and Soraya Sweeney.
Yes.
Did you also, or were you also present in follow-up interviews with all of the first responders to the home in Duxbury on January 24th?
Not all of them, but a lot of them.
So that would have been a majority of the paramedics/firefighters from the different towns?
Yes.
On June 12th of 2023, did you apply for and receive a search warrant for 47 Summer Street?
Yes.
And why did you ask for a search warrant then, in June of 2023?
We were reviewing photos, crime scene photos, and someone noticed that there was potentially blood stains on the outside of the house that we had not swabbed.
So to your knowledge, on the date of the incident on January 24th, the stains on the outside of the house were not swabbed and collected by the crime lab, right?
Correct.
Did you have further conversations with forensic scientists at the crime lab to determine the viability of obtaining additional swabs all those months later?
By the way, yes, Cat's Eye, why are we circling back? We've seen, the jury has seen the footage from CVS and 3V. The defense and the state have stipulated to the shingles being tested. And we've already heard from the witness who tested the dadgum shingles. What the hell?
Allow that, the question just yes or no. Did you speak to somebody, not the answer?
So did you speak to somebody at the crime lab about the possibility of obtaining some biological substances from the home?
Yes.
And as a result of your conversations, did you then apply and were granted a search warrant?
Yes.
So subsequently, some swabs and shingles were collected from the home at 47 Summer Street?
Correct.
And were you present when that was done?
I was.
On May 15th, 2024, did you have the occasion to go to the Tewksbury State Hospital?
Yes.
And what was the purpose of going there?
To collect DNA from the defendant.
And is there a particular procedure that you, as an investigator, use in order to collect a DNA sample from somebody?
Yeah, we use a DNA collection kit. It has a foam swab that you use to swab the inside of a person's mouth to collect saliva. That's then transferred to a collection card. We let it dry, then seal the kit.
So the swab kind of looks like a lollipop?
Yes.
With a foam and...
Yes.
And you're trained on how to swab the inside of a person's cheek on both sides in order to obtain an adequate sample?
Yes.
And you did that in this case?
I did.
Who did you collect the sample from?
The defendant.
And that would be Lindsay Clancy?
Correct.
Were other people present when you did this?
Yes.
Who were they?
Sergeant Josh McElligan, DPH Police Chief Michael Riggs, and Attorney Reddington.
What did you do with the sample that was collected from the defendant on May 15th, 2024 at the Tewksbury State Hospital?
It was placed in a temporary evidence at the DA's office.
Was that sample then later transported to the State Police Crime Lab?
Yes.
Now, another thing that you did in this investigation sometime later was seek search warrants to Facebook, or what's known as Meta, correct?
Correct.
As well as a particular Facebook group called Attachment Parenting for Littles.
Correct.
As a result of that warrant, did you receive data back from Facebook?
I did.
And were you able to confirm a Facebook page in the name of Lindsay Marie Clancy?
Yes.
Were you also able to confirm that there's a particular post by the person named Lindsay Marie Clancy, or the Facebook page Lindsay Marie Clancy, on May 5th, 2021, to the Attachment Parenting for Littles group?
Yes.
I'm just going to approach. May?
You may.
I have no problem with the foundation.
No objection? Okay.
I'm just going to show you a document. Is that familiar to you?
Yes.
And is this the Facebook post posted by Lindsay Marie Clancy on May 5th, 2021?
It is.
I'll move to admit this as the next exhibit.
No objection? That may be admitted.
Sergeant Cacchio, just showing you what's now been marked as Exhibit 217 on the screen. Is that a Facebook post from the Attachment Parenting for Littles Facebook group?
Yes.
And through the information you received from the search warrant return, you were able to locate the content of this post in the records for the Attachment Parenting for Littles and confirm that it also appeared to be authored by Lindsay Marie Clancy, correct?
Correct.
Or by the Facebook page of Lindsay Marie Clancy.
Yes.
And fair to say it reads, "Hello, lovely parents. I'm looking for some advice, solidarity, ideas, something, anything. I'm truly finding my 19-month-old to be the most difficult human I've ever encountered. I mean that with all love in my heart, but I honestly cannot make it through a day without getting so frustrated with him. He's not my first child, so not to compare, because I know that every child is different, but just for background, this isn't my first rodeo. Every single thing with him is a battle, and it has been this way for a while, since he was maybe 8 months old. I really try to pick my battles and only do what's completely necessary, but I mean everything, getting out of his crib in the morning and going downstairs, changing his diaper, getting him dressed, getting him in his seat to eat, getting him in the car seat, getting him out of the car seat, putting on his jacket and shoes to go outside, having him come inside when it's time, going to sleep for his nap, and at night, he fights me every step of the way with all these normal daily activities, It constantly feels like I have to force him to do these things, which feels so wrong, but he is always fighting me and crying about doing these very normal things. You recall seeing that message in the records.
I do.
And fair to say there was some comments to the records and also an acknowledgement by the person with the Facebook page, Lindsay Clancy, thanking the contributors for their advice.
Yes.
I have no further questions.
Mr. Reddington.
Good afternoon, sir.
So this would be Exhibit 217, which is the Parenting for Littles post by Lindsay, correct?
Correct.
And this was back in May of 2021?
Yes.
And she was talking about her son, who at the time was 19 months old?
That's correct.
Now, as a state police officer, you know how to investigate things, right?
Yes.
You guys must have turned things inside out to find out if Lindsay Clancy was ever abusive to her son, Dawson, right?
That's correct.
Found nothing, did you?
No.
Thank you. That's all I have.
Anything on that?
No, thank you.
Thank you, sir. You may step down.
Thank you, Your Honor.
What an absolutely colossal waste of time. LB says, Jen Lou, I tune into your channel just to hear you vent. Love it. Actually look forward to the breaks. I appreciate that, babe. Really, I do. Thank you so much. So much. Okay. This was a colossal waste of time because I think what the state is trying to imply in this situation is that, with that post, is that her frustration was at Callan and that it was to make it seem as if she didn't like Callan, I guess. And actually, that post is actually, I think, is a red flag for her mental health, because I don't think that he was actually fighting her on those things. I think that's especially because she used the word force. The fact of the matter is, an 8-month-old, a 7-month-old, a 6-month-old, they don't have complete autonomy and say in things, right? If you need to go somewhere, you pick them up, you carry them out to the car, you put them in the car seat. Now they might wiggle, but and cry, but it's the use of the word force. To me, what I would take from that post is that her perception of reality is very skewed. Something is off. That's what I would say. I'm sorry about Dawson. I meant to say Dawson. I'm sorry about Dawson. To me, I think that even Dawson, even a child Dawson's age, you can't, they don't have, we're not talking about a 6, 7, 8, 9-year-old here. We're not talking about a teenager here. I think the use of the word force, I think, is indicative of, I think that her perception of reality was skewed. 19 months old is still young. It's under 2. Yes, they're walking. Yes, they can talk. Yes, they can, they are independent in many ways, but they're also in many ways very reliant on their parents or their caregivers to do everything for them for the most part. I mean, can they feed themselves? Sure, but they can't prepare their own meal. They can't go to the refrigerator and get out a Go-Gurt and open it themselves even. They can't, there's a lot of things they cannot do. And I disagree with you here, Little Red, but we'll get there in a second. I think that it's indicative. I think the way that she is perceiving Dawson's behavior, I do not think is in touch with reality. And I say that based on the testimony also from the daycare workers, because that's not how they describe Dawson. And so I think that her perception of him, quote unquote, fighting her, I don't think is accurate. I think he was actually being just a typical kid. I think her perception of reality was quite skewed. Little Red says, I agree, Jen Lu. She has a very controlling personality. She could not control every moment with her children, and it affected her mentally, in my opinion. I disagree. I don't think she was a very controlling person. I think people mistake the need for organization for control. That's what I think. I think she was a very organized person, and I think that she was a very structured person. And I think that having a schedule for children, it's not like we've had a shitload of testimony that if the kids didn't, if the bedtime was at 8 o'clock and they were in bed at 8:10, she had a complete come apart or even a little come apart. We haven't heard that. Their evidence of control is a notebook exchange between herself and the nanny where she's explaining the size of the vegetables to cut up, how to cut them up. That's helpful information for a nanny. There are children who like things a certain way. And if you know what works for your kids, it's better to let the person who's taking care of them know, hey, this is what works. Make it easy on yourself. I don't think she's controlling at all. At all. I think she's just organized. And I think a lot of people mistake somebody being needing, I have to have things organized. If things are all wonky and unorganized and all of that, like a cluttered home is a cluttered mind, and it makes my mind cluttered and I can't focus. It makes it hard. But I don't expect other people to be as organized as I am. And there's no evidence that Lindsay expected other people to be as organized as she is. So I don't think she's controlling at all.
Watch your step, please, sir.
Sure.
I mean, it is, and Shamita, you're right. And I that came out a little harsh. I'm just tired. I'm sorry, Lil Red. I do appreciate your opinion. I just disagree with it, babe. Shamita said, sometimes it's the kids who are controlling. LOL, I just pick my battles. There are children who, like my oldest son. My oldest son was real finicky about certain textures of food. And so, but when you have 3 little ones, you can't make 3 separate dinners. But what you can do is you can alter a little bit the way you prepare one kid's food. Do you know what I'm saying? And that's what I would have to do. Now, I would not say that I think what Shmita means to say, or how I would put it, is that when you have children, it becomes about the children, what they like, what they want, what they need, all of those things. So the children, are somewhat, I mean, the household as it should revolves around the children. I just don't see Lindsay as controlling. I just don't. That
All right.
It came out a little hard.
Members of the jury, there's a motion or a hearing I have to do with the lawyers, and it's going to take a little bit of a while. So I'm going to excuse you for today. Come back tomorrow, 9 o'clock. One of the questions I asked over here was, where are we on the time estimate? All right. I'm told that we are on schedule, if not ahead of schedule, in regards to what we told you. All right.
Okay, Judge. Yeah, with Shmita's example in the chat, the hot dog situation. Look, Livy likes a hot dog, but she likes the hot dog assembled in a certain way. She likes me to put the hot dog in the bun, you know, the Kraft singles, fold that in half so it makes 2 triangles. Put both triangles on either side of the hot dog, put it in the microwave to melt the cheese a little bit, then add mustard. That's how she likes it put together. It's not controlling, it's just her preference.
Right, so I'm going to excuse.
Yeah, bye.
Similar case.
All right,
Don't
hold on.
read, list
Let's
field
see.
trips. Don't we just want to have a
All right, let's see if we get to hear this damn motion order. I know it's okay if we disagree, Loretta, and I appreciate that, but I think my tone was a little stank, and I didn't mean for it to be stank. I'm sorry. It came off harsh, and I think it's not your fault. It's really not. It was me, and I shouldn't have been like that aggressive, and I apologize. It's not that stank ass tone does not invite discussion. I'm sorry. Now let's see what this motion hearing is about, such that we had to dismiss the jury for the entire rest of the day at 2:41 p.m. on a Thursday in August. And we've had so many friggin' half days, no days, early days.
We're going to be in recess until 3 o'clock. We're going to come back. We'll have a hearing on the defendant's motion for permission to call certain witnesses. And so we'll have a hearing on that at 3 o'clock. All right, so we'll be in recess.
What?
So basically, parties can kind of get themselves oriented in regards to that motion. So we'll be in recess.
Court, all rise.
Are they? What? Hold on a minute. I need a moment. We're going to play several videos.
What a bunch of a-holes.
I'm so tired of you.
Where is it? Where's the one that I like the most? Shit, I can't even find it. Oh, here it is.
What you just said is one of the most insanely idiotic things I have ever heard. At no point in your rambling, incoherent response were you even close to anything that could be considered a rational thought. Everyone in this room is now dumber for having listened to it.
I mean, it's up to you guys, Nate. We can be done, or we can sit here and, for the next 15 minutes. If you guys want, I don't mind sitting here for the next 15 minutes. They've already been to lunch. They've already, this little red, I just love how optimistic you are, sweet P. No, baby, they just came back from lunch. They came back from lunch. They've had one friggin' witness, and now sidebar, and now peace out, Girl Scout. We got a motion, but they're going to be back at 3. It's 2:44 their time. I don't understand what the lawyers need to orient themselves to. First of all, the defense is the one that filed it. So if anybody is oriented, it should be the dadgum defense. They filed this motion. It's their motion. I have a feeling, based on what the judge said, there was a hearing held. There was a motions hearing held in the midst of jury selection. And I intentionally did not watch it. I didn't, like I said, I wanted to be as open as possible. And you see, we're on day 8, and I've already got stank attitude for no reason. There's no reason for me to have a stank attitude and a stank tone. I'm so sorry to the chat. I think I got a little worked up with the vent session. I'm still pissed off about the whole AC situation. I don't like my intelligence insulted, and I'm still salty about it, clearly. So again, we're back to Bendy cannot move on from things quickly, if at all. Um, I think, okay, so back on task. So during the jury selection, there was a motion hearing held in the midst, and the defense wanted a witness, an expert witness, to testify. And at that time, the judge said no. Now, I wonder if, okay, so he said, all I know is that the motion was denied, that the witness was not going to be allowed to testify. I don't know. I'm wondering if there was language like we saw, like during the Corey Richins trial, where Judge Mraz said, no, but if the prosecution opens the door, then the witness can testify. So I'm wondering if the defense, or excuse me, the Commonwealth opened the door, and that is why this is happening. That now they're renewing their motion. Like I'm wondering if it has something to do with the last witness. It can't, no, because I wonder when he fought. Let me see if we can find this. This is Plymouth County, right? Let's see. Let's see. We can find this. Sorry, you guys. Just want to see. What the fuck? Hold on. I had to have done this wrong. How is there no records found? Let me look. Criminal. Sorry, you guys have to sit here while it's quiet. I'm sorry. I'm trying to see what he filed, if we can see it. Oh. Jeez, Jen. Hold on. Yeah, let's do that. All right, let's see. What are you guys saying? All right, let's see if I can find her. Why can we not find Lindsay Clancy? Here it is. All right. We're going to scroll down. We're only on 2023 of the docket. So weird. There's nothing. Sorry, you guys. This is terrible. Not professional at all. But I mean, I can't see any of, maybe it doesn't let you or something. Hold on, let me see this. I see all of her charges. But I don't see. I don't see anything after 2023. Oh, I bet you know what? I bet I know why. I have to go back. Hold on. All right, I know what I did wrong. That's my bad. What's today? Let me do it like this. What the fuck? Why can't I find her docket? I mean, I have her docket, but what I can't find is anything that he filed, like anything today. So maybe we'll just do it like this. Because I found it before, so now I just have to figure out how I did it again, how I did it. Well, I cannot find it. I can't figure. I don't want to sit here and just make you guys listen to me endlessly click to figure out. Because I know it's Plymouth County. It's Superior Court, right? Let's try open. Searching by her name did not pull up anything, which is weird because I know they clearly have a docket for her. Let me try again. Let me try. This is irritating me now. Okay. They should have a case. They should have a. Well, they're back in now. So I guess it's pointless. I'll figure it out and I'll get back to you guys.
Return back to the matter, Commonwealth versus Lindsay Clancy. All parties are present, excluding the jury.
All right. Well, what I wanted to do was hear the arguments in regards to the defendant's motion for permission to call witnesses. I know that this was filed this morning, but it's kind of hand in glove with issues that were raised a couple of weeks ago. At least mentioned the same witnesses. So I'm going to hear first from the defendant. They'll hear from the Commonwealth. I will probably take it under advisement and review some of the other documents, but I want to make this decision as soon as I can, so everybody kind of can plan on how they go based on the decision. So Mr. Reddington, let me hear you first on this.
Thank you. Your Honor, obviously, I don't have to belabor the obvious. This is a murder trial, very serious business, and we've all been working very hard on the discovery, which, as you can tell, is voluminous. Hundreds and hundreds and hundreds of pages of state police interviews. And I mentioned, about with the government. They have cops. They have people going out and interviewing. They have videos. They have chemists. They have detectives. They have local cops. They want a cup of coffee. They can send 5 cops down the street to get one. I'm it, except for my son, Patrick, who helps me out getting coffee, all right? And the reason I sound frustrated is that they're objecting 2 weeks ago because they need time to review, to cross-examine doctors on very basic items of evidence that are their items of evidence. Not one of those witnesses is adding or bringing anything new to the discovery, if you will. And not by way of excuse, but, I am a sole practitioner. In the past, May, June, July, in the past 3 months, I've had a murder, a rape, and 2 back-to-back federal trials that ended 1 week before we impaneled on this case. I have worked really hard to pull this case together with expert witnesses, civilian witnesses, private investigators been investigating. I provide everything to them as soon as I get it, and they have been doing the same with me. I haven't objected to one thing that they have offered. They put an AutoCAD, computer animated display disc on my desk last week. I didn't complain about it, run to you and try to exclude it. I said, fine, no problem, put it in my pile and move on. That's it. So to suggest that they need time to be able to cross-examine both, I've had trials with both of these prosecutors. They're both experienced. They're very, very familiar with the trial of major criminal cases. I feel that they're more than capable of being able to cross-examine, for example, number one, Dr. Volkovich, who is a board-certified emergency medicine physician. His report indicates that he has taken a look at South Shore Hospital, he's taken a look at the Brigham and Women's Hospital, he's taken a look at the photographs. That's their evidence. That's all he looked at. And all he's doing is basically what all of their South Shore doctors came in and testified to as to the nature of the injuries, in his opinion, the type of injury that she suffered, talking about the injuries to the right and left wrist as well as the neck. In his opinion, dealing with suicide attempts, that it's a legitimate suicide attempt. There's no secrets, there's nothing new that they have to prepare to cross-examine him on. Dr. Laposada is a doctor that is well known to most of us, and I've been using Dr. Laposada's fine services for the past decade or longer. I know that both of these attorneys are familiar with her. She's not bringing anything new to the table. She's bringing her opinion based upon their evidence as to the medical records, x-rays, all of the rest of the indicia of the injury that she suffered. Now, they're talking about Lindsay going out and hanging off of a window and then doing, like I said, the Spider-Man slide down the side of the house, apparently. Absolutely ridiculous. She dove out that window, she hit her head, and she suffered what Dr. Laposada refers to as a Jefferson fracture of the spine that is very, very, very typical for this type of an injury. When somebody dives into the shallow end of a pool, they get that injury, unfortunately. When somebody, kids are on a boat and they're drunk and one of them jumps off a mast into the shallow end of the water off of Cape Cod, they get that type of injury. Superman, when he gets thrown off the horse, 6 feet high, same injury. That's all. She's not bringing any esoteric theory to this case that they need time to prepare. Interestingly enough, the Brigham and Women's Hospital records do make reference to the Jefferson fracture, right from jump. She also assists me, as she always does, on autopsy photographs, any indicia of injuries, and it's her opinion that if they try to say that there are bruises to these little babies that were inflicted by her, they're absolutely wrong, and Dr. Laposada would indicate that these are consistent with either EMT, God bless those first responders, but they were in a panic and they're trying to take care of these kids and pick them up and run them up to their trucks and vehicles. So, and other, obviously, the interosseous injection into the legs, the shins, the thighs, all of these bruises are from medical intervention, not Lindsay Clancy. That's what she would testify to. That's it. They don't need time to prepare to cross-examine for that. Finally, I have Dr. Condi. Dr. Condi signed even better than a report. He signed an affidavit. And again, it's based upon medical records that we all have. Way back when this case first started, the government presented the case to the grand jury. First thing I said to Lindsay was sign a release. Let the government get all the medical records. We'll all have access to them. This case is obviously going to be predicated upon the medical records, psychiatric records. We signed every release. They got every document and had them into the grand jury. I got copies. They have copies. Condi would testify to the horrific, in his opinion, failure to comply with the standard of care that would govern psychiatrists, psychologists, Dr. Tufts, who's going to be testifying tomorrow, nurse practitioner Gelada, the other individual from the McLean Hospital, all records that they've had for years. So they don't need time to prepare for cross-examination. So weeks ago, counsel, after I gave them copies of all of these reports and affidavit, strike that, I'm sorry, the reports I just got, and I just sent them the affidavit from Condi they already have, I disclosed to them what my opinion would be of the opinions from these doctors that would be testifying, and the report carries that out. I suggest to the court that to strip Lindsay's ability to present evidence in support of her defense, number one, it would not be in the interest of justice. I'd like to hear a DA stand up and say, in the interest of justice in this case, because weeks ago we got this information and we're not prepared to testify, to cross-examine the testifying witnesses, I think even Your Honor would agree is a disingenuous argument. She came in and said to you, oh, Rule 14 matters, and it applies to the government just as it applies to the defense, and therefore you should exclude these witnesses. Well, if I messed up, and it's my trial schedule that caused me to not be able to have written reports of the stuff that they've had for years to prepare to cross-examine these witnesses, then it's my fault, and it deprives her of effective assistance of counsel, because that would then deprive her of her defense. This is a pathologist, an emergency room doctor, and a doctor who would testify to the standards that would apply to these doctors that they're going to call as their witnesses, which is another interesting fillip, if you will, where they're calling Tufts, Gelada, the other individuals from McLean, all treating physicians of her that are all lined up to come in and testify against her on this case. Fine, bring it. But at least give me the ammunition to counter it.
Let me ask you this, I kind of go backwards. In regards to Dr. Condi, the affidavit really speaks more towards the standard of care.
That's right. He's not giving an opinion of criminal responsibility.
Right, but I'm struggling to see how that comes in. Now, maybe.
Well, he's the
right.
doctor that I'm using for
right.
toxicology.
That's what I feel. But though, the reason I'm asking that is, I'm not sure. In this case, is this the standard of care necessarily as relevant as to in regards as opposed to causation?
The standard of care is the problem. That's what caused all of this. That's his argument, is that it was a failure to maintain the very basic standard of care respective to her psychiatric care. So what are you asking, Judge? Because I mean, I only have a GED and I understand this.
Do you know what I mean?
No.
I think the standard of care does speak to causation. He doesn't have to use it as standard of care. He can use it as his opinion as to the first doctor that she spoke to, Dr. Tufts, when she presents with a bipolar 1 presentation, and then Tufts prescribes an SSRI to her, which flies in the face of any rational psychiatrist and what they would prescribe and do. He's more than qualified to testify.
That's a different question, and that may be more admissible than someone saying, oh, I found what the standard of care, and I find that this violates it. If we have got an expert who says, listen, I am qualified, I looked at these records, I disagree with that treatment, I'd be more inclined to allow that than to get into the standard of care, which is obviously consistent more with the civil world.
So with that, I can reach out to Dr. Condi and have him delete reference to standard of care in his report.
This is a good question. Low Red said, standard of care is subjective. Is the patient not responsible for giving a complete history to the treating physicians? Just not sure. Well, the argument being made by the defense is she articulated in the best way that she knew how what her symptoms were. And the treating physician his argument is she presented as bipolar 1, and that the treating physician should have recognized that she presented as a bipolar 1 and therefore not prescribed SSRIs.
And address the actual treatment as to an opinion as to its appropriateness. But again, on the issue that they're raising, that they need time to prepare to cross-examine, I don't think that lies when, even if he revises his report by removing standard of care.
Well, let me ask you this, because I haven't had an opportunity. This is probably what I'm going to have to look at tonight. Is Dr. Condi adding anything to the expert disclosures that have already been made? Because I know there's disclosures.
He's taking the medical records, Tufts, Gelada, McLean Hospital, and just commenting on the care and the treatment that was presented to her as a patient looking for help. That's all he's doing. He's not adding anything. He's talking about the prescriptions that were provided to her, the SSRIs, the antipsychotics, the benzodiazepines, all of that. That's what his opinion is predicated upon, which is all of the prescriptions that the government has already introduced into evidence and is well aware of.
Right, I understand, but I know that the parties have already exchanged reports months ago, and I know that everybody did that. And I haven't had a chance to review specifically the defendant's reports. And I don't, is there an expert who's going to address these kind of issues already?
So Lil Red says, I thought she told him it was postpartum, that she had never been diagnosed with bipolar before. I am not sure which is right. It's really not Lindsay. Okay, so what Lindsay can report is her symptoms. And if she's asked, have you ever been diagnosed with schizophrenia, with bipolar, with depression? And she can answer yes or no to that, right? But if she's presenting with, it's the provider's responsibility to ask deeper, more probing questions as to her symptoms, not just throw a bunch of prescriptions at her. That's the argument that's being made. So if, and Neat Noodle said, standard of care seems more relevant in the civil suit. No? Okay. And I think that's the judge's position as well. So what Reddington is saying is, okay, I can have him alter I don't know. I can have the doctor alter the report to remove any language respective to standard of care and just speak to, she presented with these symptoms. These symptoms are more indicative of a bipolar 1 than actually just depression. And so, therefore, when you give a person who is presenting with bipolar 1 and you treat with bipolar 1 symptoms and you prescribe them an SSRI, which is indicated for a major depressive disorder, it doesn't work. And and frequently exacerbates all of the symptoms of bipolar 1. I think that is what he's trying to get in. And Little Red says, if we're not getting better, would you go get a second opinion? She did. She saw many different doctors. Some of them are in the same practice. Now, that being said, the state has basically said that she was pill seeking and attention seeking by doing that. You're welcome. You're welcome for shiggles. Shamina is over it and says BS. She continued to go. Now, the question that I have is, why didn't she go to the hospital she worked at? LB Hayes says, so just to clarify, is the defense asking for another witness to testify, like as an outsider looking in on the entirety of her case or entirety of her care, to give a medical opinion on what they feel was done right or wrong? From the doctor they're talking about now, pretty much. Pretty much. The other doctors that the defense is trying to get in are going to testify to her injuries, the spinal injuries and the self-inflicted injuries to her wrists and to her neck, to show that she indeed, this was a serious attempt, not as the state has alleged. Adrian says, embarrassing maybe, and worried about losing her job. I mean, that could be. I just wondered. And the only reason I asked that is because my mom worked as a histologist for John Peter Smith Hospital in Fort Worth. It is the Tarrant County hospital. It's the county hospital for Tarrant County. There, that's better, right? And when we needed to see doctors, that's where we went. And they used to have back then, they had the family health clinic, but they had like the employee family health clinic. And that's where we were seen. And so Daisy said, I'm not sure which hospital she worked at, but maybe it wasn't in her insurance network. I mean, that's possible too. I'm just curious why she didn't. That's all. I wonder if because one of the other chatters that is Teacup that's in here all the time has family who has knowledge of South Shore Hospital and evidently doesn't think too highly of it. And so I'm wondering if she was aware of their reputation and all of that. So, I think that Lindsay did her level best to try to get help. I think the state, and that's just the state's presentation of evidence based on the evidence they've submitted thus far, presented thus far. To me, I think it appears as if she tried her level best. All right, here we go.
No, Dr. Condi was my toxicologist and my physician that would give an opinion as to the appropriateness of the treatment that she received, especially as it relates to the prescriptions. I mean, Dr. Lapisader is a pathologist. She has nothing to do with it. Dr. Zeisel is a psychologist. He has nothing to do with it. Dr. Resnick is a psychiatrist specializing in infanticide. He's not addressing that issue, and nor is Dr. Spinelli, who is a postpartum depression, postpartum psychosis expert. So Dr. Condi is my expert for toxicology and level of care that she received.
All right.
LB says, how normal is it to bring in new witnesses like that in a court case? In court cases like this, are these big asks? Well, my thing here is, it doesn't sound like these are new witnesses. And that the defense and the state have exchanged reports months ago. So it's kind of hard to tell, to be honest with you. Shamina says there's so many others on meds with diagnoses that don't murder. That's absolutely correct. That's absolutely correct. That's true. And I think what the defense is arguing here is these are unusual circumstances with horrific results. That there are many people who are prescribed these medications, and this never happens. That this doesn't happen to them. However, I think his other argument is that those people that were prescribed these medications were prescribed these specifically the selective serotonin reuptake inhibitors, the SSRIs. I think his argument is that people who are prescribed those medications were prescribed those medications correctly to correctly treat their specific mental illness. In this case, Lindsay, they were prescribed to her, and they were prescribed the wrong medication was prescribed to treat what she was going through. They thought the providers were treating depression when they should have been treating. This is his argument, not mine. I'm not a doctor. They should have been treating bipolar 1. All of the signs reported and all the signs and symptoms were reported by not just Lindsay, but Patrick attended as well. At least one time we know, are more indicative of a bipolar 1 situation than a major depressive disorder, postpartum depression. And that does happen sometimes too. And it doesn't result in this, but it can. And in this situation, it did. And that's what this defense is arguing.
Which guts the defense if their argument that they need time to cross-examine or prepare results in an exclusion.
Okay, come on.
Thank you, Your Honor. With regard to Dr. Condi, one of my points is going to be that his affidavit addresses the standard of care, which is more of the civil issue, but you've already addressed that with defense counsel's pivot that he would then instead testify about the treatment of the defendant in toxicology. Looking at the affidavit in which he outlines his qualifications, he's not a toxicologist. He's a physician licensed here in Massachusetts. He's done a residency in general psychiatry, child and adolescent psychiatry, and forensic psychiatry, but he's not a toxicologist. And also, it's not just us having all the same records that makes for cross-examination to be fundamentally fair. There's more to cross-examination than just having the underlying data. It's also knowing more about the expert, being able to look into their publications and their prior testimony, and being able to prepare to rebut anything that they might testify to. And where we have this late disclosure, which was 1 week prior to trial starting, that's fundamentally unfair to the Commonwealth. And I think what Dr. Condi would be testifying to, if it's just limited to her treatment and what was prescribed to her, that's covered by the other 3 experts that defense already has. They all talk about her treatment, the prescription she was on, and the effects those had on her. So I think that would be redundant, and it would be unfair to the Commonwealth to add this 4th expert to talk about the same things that the other 3 experts are going to talk about when we haven't had a chance to prepare for this particular expert. For Dr. La Posada, what we have is a 2.5-page letter to Attorney Reddington outlining her thoughts, but it doesn't say what her opinions are based on. It doesn't say which materials she's reviewed and what she's relying on. So I would suggest that it's an insufficient report. And again, with the delayed disclosure, for example, she talks about Jefferson fracture causing the injuries. Well, if we had this information previously and knew this is what they were going to argue, we could have obtained our own expert to talk about the mechanism of injury and Jefferson fractures and all of those things. But we weren't told.
I'll say this, as the state, as the Commonwealth, if you didn't watch Dr. La Posada testify during the Karen Reed trial, regardless of how you feel one way or the other, whether you think she's factually guilty, legally she's not guilty, she was acquitted. But regardless of your stance on that, the fact of the matter is Dr. La Posada is an incredibly affable witness, expert witness at that. She's fantastic at explaining things. She engages the jury. Her when she does give explanations are very easy to understand. And even when Brennan on cross-examination, she tried to get her, catch her up, get her caught up. She's unflappable. And so, you guys keep talking about privacy with respect to her job and being seen at a hospital that she worked at. That's the absolute definition of HIPAA, Health Information Portability and Accountability Act. Okay. That is part of what HIPAA protects. It protects your health information from your employers.
Told until a week before trial that she would even potentially be a witness, and then we get this report on July 26th. That's a 2.5-page letter.
But didn't we have multiple trauma surgeons, neurosurgeons who've testified, who treated her? Couldn't someone just ask, is that consistent with, and that's pretty much, if I'm looking at Dr. La Posada's note, I'm not sure I would allow in opinions regarding whether or not it's a serious suicide or not, but she does indicate it's consistent with landing on on an individual's head.
Well, Your Honor, we had a trauma surgeon from the South Shore Hospital testify who said that the injuries that Ms. Clancy sustained were a level 1 and she had to be transported to another hospital where doctors who were trained.
Right, but you completely and totally fucking avoided asking that doctor on the stand how a person would get that injury. Stop playing with these people.
And those injuries could operate on her. So we didn't think that she would have the knowledge and the training and experience to testify about the nature of those injuries and how they occur. The trauma surgeon from Brigham and Women's Hospital is with the military and is overseas in the Middle East, and so was unavailable.
Oh.
But had we known that this was going to be an issue.
Okay, so here's the one person that they were able to call to the stand doesn't have the experience and education necessary to make comments on that, but you have low-key thrown shade every which way that you could, implying that this was not a serious suicide attempt, and that you brought on a blood stain. You're getting me feisty and yelly. I'm letting myself get that way. Calm down, Bindi. So but instead you skirted that issue, and you had a blood stain analyst basically testify that she dangled out of the window, but he can't ask if they don't. So he's limited, on his cross. He's limited in scope by what's asked on direct. So what the Commonwealth has done is, because the one person who could answer that is in the military and is now deployed overseas, they tried to get that it was that she dangled out of the window, and that's how she got that injury, in through other testimony, specifically the blood stain analyst.
When they were going to allege this particular type of fracture, we would have endeavored to get another expert in place, and so was unavailable. But had we known that this was going to be an issue and they were going to allege this particular type of fracture, we would have endeavored to get another expert in replace of the doctor who treated her at Brigham and Women's. But we didn't know that this would even be an issue until a week before trial. And again, this letter is dated July 26th, and it doesn't tell us which records, which reports, or which, what medical journals or training or anything that these opinions are based on.
Well, that could be done by voir dire. I mean, the Commonwealth has at least inferred through their case that this was not a serious suicide attempt, right? I mean, and there's questions about whether or not someone's hanging outside the window or not. And so why wasn't this an issue that the Commonwealth could have anticipated would come up?
Is that not what I just asked? Is that not exactly the question that I had? Little old me over here, 50 years old, sitting over here, streaming this trial with my good enough diploma, asking the same questions the judge was, that the judge just asked. And let me just say this, Your Honor, even though at first I was side-eyeing you because you seem to time your sidebars and your breaks just when I would step outside for a cig, it almost felt personal to me. And I was really like, is this judge coming for me? Just kidding. I didn't really think that, but you know what I'm saying, right? They've implied all of this stuff. They have implied all of this stuff without actually having a medical expert get up on that stand and say that. That's exactly. So now, even if the fates have aligned in some kind of weird ass way between the courtroom and my house that make it where I have to haul ass in real quick in the middle of a cig, I don't even care anymore because this judge just asked the best question ever.
The position of the Commonwealth isn't that it wasn't a serious suicide attempt. It's that the methods that were chosen were insufficient to achieve the goal. And the reasons for that, we would argue in our closing. I don't think we have to disclose that theory at this point, but we've never said it wasn't a serious suicide attempt. We've never said it was a fake suicide attempt. What we've endeavored to develop from the testimony is that the methods that were chosen were methods that would be unsuccessful, but we're not saying it wasn't a serious attempt. And I think the reasons for that will become clearer when the doctors give their testimony. But it's our position that she was attempting to kill herself that night, and there are various reasons and factors where she was unsuccessful in killing herself, but successful in killing her children.
But there's been all kinds of testimony regarding, it seems to be a dispute of whether or not she's hanging from the windowsill or goes out head first. There's some testimony that's been raised, even with the blood experts, things that she may have been hanging from the windowsill. Dr. Lapasato, it seems what they're seeking is those injuries are consistent with somebody who lands on their head.
So would the court allow us to call a witness who's not on our witness list to rebut that evidence?
Yeah, I would consider that. Sure. I would have no problem with that. And this is kind of what, why I didn't make a decision on this earlier, because I had to kind of see how the case develops. And this issue of how this injury occurs is certainly, it's either been specifically and explicitly raised or inferred in multiple questions. Even to the length to the part of, the cuts and things like that. It's been over and over and over. So if the Commonwealth seeks to get somebody to rebut that, I would strongly consider that. And in regards to Dr. Lapasada's opinion, we may need a voir dire in regards to, but I wouldn't imagine the voir dire would take that long. It would be, did you view, the x-rays. I mean, that kind of an injury is probably pretty clear on the x-rays or the MRIs.
If we could get a list from defense counsel on what she's basing her opinion on, so we can have our witness review the same material.
Let me tell you right now, it's just simple. It's just the South Shore Hospital medical records, Brigham and Women's medical records that have already been discussed with the jury.
Why don't we do this, just so it's clear, because when a witness is on the stand, it's much easier to have something in writing to say, is this what you relied on? So if you could get from Dr. La Posada what she is relying upon to form that opinion, I'm like I said, I'm inclined to allow that opinion, and I would allow then the Commonwealth to present a rebuttal witness if they seek to.
And just note our objection
Sure.
to that, but also the third expert, what we have here is a letter dated August 4th. That's a page and a half. That's not even signed by, I believe it's Dr. Volkovich.
Yeah. I'm more concerned with that is whether or not the opinion is admissible. The opinion, as I see it, is he's reviewed the medical records, and it's his opinion these are injuries that commonly observed in, the quote is, serious suicide attempts.
We could delete serious.
Yeah, I mean, or even suicide attempts. That's an opinion.
Their doctors waxed eloquently about suicide and whether
Right.
or not it's, I mean,
But
we could delete serious.
But I'm just concerned that how are we going to kind of parse out what he looked at? 100 other cases, and then we go through into all of those. So I'm going to have to take a look. That's what I'm going to take under advisement for sure. That doesn't mean he may have other opinions I'm going to have to look at. I think he talked about some of his observations as an emergency room doctor, I think, didn't he? Yeah, I'm more reluctant to allow in that individual's opinion that this was a suicide attempt.
So their South Shore doctors are able to talk about, superficial, as we've heard for a week now, but his opinion that it's consistent with what he's observed in his emergency room treatment is not admissible.
No, that's not what I'm saying.
Oh, I'm sorry.
What I'm saying is that he can't necessarily give the opinion, I've looked at this, it's my opinion, this was a suicide attempt. But he could certainly testify, I've looked at the cuts, these are, the phrase superficial. I think that's been kind of mixed up in this whole thing too. That seems to be more of a medical term.
Yep. What I said. I feel like I need to I'm going to have to cut it out at the end, but I'm feeling a little, I'm feeling like I hear in my own brain, and I think I should put it in the background just for now. Not to toot my own horn, but toot toot. Damn, it feels good to be a gangster. I kind of want to play a little Ghetto Boys, not gonna lie. Because that's exactly what they've done. They have put on this medical term of superficial and left it with the jury that the medical term superficial is synonymous with the layperson's term superficial. Now, to answer Neat up here, Neat says, where'd you go, Neat? She said, did she just basically admit that they haven't gotten to their reason yet? She has admitted that they have not gotten to the reason why. Yes, but I want to be very specific about this. She admitted to that they have not gotten to the reason why Lindsay was successful in killing her children, but unsuccessful in killing herself, which just by that statement alone suggests that this was not a suicide attempt where the person intended to die. I don't like to using the word serious. I don't know. It just feels wrong. It's as if that statement to me implies that the state believes, I guess to use their own word, this was not a serious attempt. That's what it feels like. That's what it seems like, I should say. That the state very much has been saying this was not I need to find another adjective. Let me get on the Googles. Let's listen to what else they have to say.
As opposed to
Well, no, they basically beat it to death with not being a medical term until we were able to show that, in fact, it was deep, 3.5 and 2. Okay.
Yeah, I mean, if you want to call this doctor, he's going to say, that's a significant cut.
Okay.
That's different than saying, looking at that, I find that this is a suicide attempt. Just like there's never been an opinion here that this was not a suicide attempt. That's probably something that the jury
now, but it wasn't a week ago.
Well, that's going to probably be for the jury to determine. But I would allow kind of going into the characteristics that have already been testified to. And I don't. We need a further voir dire on that doctor as well. But I think he lists in there kind of what he reviewed. But
He did.
yeah. Yep. All right. Anything else in regards to those three witnesses? Nope. All right. No. So I'm going to take this under advisement, but just kind of for what I'm inclined to do is I'm going to take a look at Dr. Condi's report and compare it to some of the other reports. I'm inclined to let Dr. La Posada testify that that the injuries are consistent with basically a fall on the head. And the last doctor, I'm going to take a look at kind of his language, but I would not be allowing in that his opinion that this is a suicide attempt. But he may testify as to all the other observations that he took from those records. All right.
Understood. Just no objection for what it's worth.
All right. And so I'll note the Commonwealth's objection. I'll note the defendant's objection.
Geez, Blair, which camera person?
And like I said, I'll take it under advisement, and everybody can renew those objections
As
again.
it relates to Condi, once you make your decision, you let me know. I can certainly reach out to him and have him delete this standard of care and just reference the actual treatment and prescriptions that you received.
All right. All right, so I'll take a look at this. I'll have this tomorrow morning for everybody when you come in.
Great.
All right?
Thank you.
So anything else we need to address?
Just in case there's a problem, Dr. La Posada has been working with a gentleman by the name of Mr. Drake, Drake Laboratories, that is putting together an auto computer animated display of coming out the window, the injuries to the neck, showing the vertebrae and that type of thing, which is all based upon evidence that's already in evidence here. So I haven't got it yet. It's not done yet. So I don't want to not say anything about it now because they'll be objecting to it tomorrow, I'm sure.
I assume we'll have to take a look at that and give the Commonwealth the opportunity to view it and hear the arguments in regards. It may be something nobody has objected to, or maybe, I don't know. All right?
Would have an objection to it, and it goes
You don't
back,
know. You haven't seen it.
It goes back to the whole position that, we have the right to, if we want to obtain another expert, and then that expert could review that material and use it to form his opinion. This is different than the 3D diagram of the house that the Commonwealth gave. The defense was on notice that was coming, the basis of it, the measurements, what the house looked like itself, and so that was turned over. This is completely different.
And I just note that, as I said, the medical records that the government has talks about Jefferson fracture. You might remember 2 weeks ago or 2.5 weeks ago when they first raised their objection, I told you that I can't know what they're going to argue until they argue it. So I didn't know whether or not they were going to say that it's a fake suicide or that she didn't jump out the window. I had to wait to see what their opening was. Now I know I have to rebut it.
We were almost out of here till you mentioned that
Yeah, I know.
3D
Sorry.
thing. So why don't we do this? We'll wait on that.
Okay.
All right? I'm not committing one way or the other in regards to that. We'll see. So you maybe the testimony with the 3D, the testimony without the 3D. We'll just kind of see where we go. All right? All right. So thanks everybody for kind of buckling down and going through that so we could resolve that as best we can. I appreciate that.
Thank you, Judge.
So we'll be in recess on this matter till tomorrow morning at 9.
Okay. So to answer Shamina, who Dr. La Posada is, basically Dr. La Posada testified that John O'Keefe's injuries were completely inconsistent with being struck by a motor vehicle, that the head injuries were from a fall. She stated that the deep lacerations and fractures to the back of John O'Keefe's head were caused by falling backwards and striking a rigid, hard surface. She noted that the pattern did not match hitting frozen ground. She disputed the prosecution's claim that John O'Keefe died from extreme cold exposure, stating his body showed no signs of frostbite or cold-related organ damage. She initially noted that the linear injuries found on O'Keefe's arm resembled marks from an animal. Now they wouldn't let that in from her, but I liked Dr. La Posada. I thought that hold on, what are you guys saying in the chat? What's Teacup Kraken saying? Teacup Kraken says she intentionally fell in a way that would result in paralysis so that people would pay attention to her for the rest of her life. Or I would add to that, she intentionally fell that way in a way that would result in paralysis and her survival so that she could be charged with the homicide of her children. So, yeah, you guys are all saying basically the implication that she hung out of the window rather than dove out of the window head first is preposterous. It doesn't make any sense. It doesn't make any sense. And I do think that the defense should be able to and should be allowed, and I'm glad that the judge is considering this, because there has been a lot, there needs to be a doctor who has treated injuries, specifically her wrist and her neck injuries. The jury needs to understand exactly what the term superficial means respective to medical terminology. Because I really think that, and the judge agrees, that the term superficial, I think the jury is thinking it means something that it doesn't. Superficial doesn't, and also, to be fair, even when they did have the doctor or the physician's assistant, the Commonwealth, when they had the physician's assistant on the stand who testified to suturing those, okay, he said, it only took like 3 or what. It's been made to seem as if they were not almost, I don't want to say, I don't like the term serious, but like staged. She made an attempt in which she didn't actually intend to die or be paralyzed. That's what the Commonwealth, the testimony has been thus far, that this was more crying for attention. that this was all staged in an effort to avoid the consequences of killing her children. But then but in their opening statement, they also did say that she did want to kill herself. And the reason she took her children with her is because she didn't want anybody. The reason she killed the children is because she didn't want anybody else to raise them. So she killed them first, and then she made an attempt that was not successful. But according to the exchange we just watched, there's a reason for that, a psychological reason, because that's who they're talking about. The doctors are going that's what the doctors are going to testify, the psychiatrists that evaluated her for the Commonwealth. What reason? What I can, now that we know, now I want to hear from the psychiatrist even more than I did before. What about you guys? All right, well, that's that. We are officially done for the day. So you guys have a fantastic rest of your afternoon and your evening. I appreciate you all being here. Thank you to the mods. If you haven't done so, please give your girl a thumbs up. If you're watching on the replay, please give your girl thumbs up, thumbs down, however you feel. If you wouldn't mind coming back and hyping the video, that'd be great. I'd appreciate that very much as well. And I'll see you guys in the AM for a Friday session, which who knows what they're going to do on Friday. Judge Bev, I will say this for this judge. Judge Bev would have said, you got it late. That's it. That's all. They're done. No, no, and no. She would have immediately ruled on it this afternoon. She wouldn't have even entertained. She might have entertained a few arguments if Alessi was making them. Because I will say this. I watched Judge Bev very closely during the Karen Reed trial, the second trial. And when Mr. Alessi was either cross-examining, direct examining, or making arguments at the podium, Bev had a look on her face like she really respected him. So, oh, they do, Jenny. It's ridiculous. They tease us for the next day and then disappoint. The end, I agree, Nate. The end of today was the best part today. Yeah, the arguments were the best part. Bye, Catherine, babe. See you next week. Have sweet dreams. All right. You guys have a great rest of your afternoon, and I'll talk to y'all later, okay? Bye.